Rhaenyra from House of the Dragon.
Absolutely.
Okay.
Do you watch House of the Dragon?
And Prime is on the opposing faction.
Yeah. So she's the blonde queen in the new Game of Thrones House of Yeah. I like the other one, which is I think Emma Cook is the actor. Is that her name?
Emma Cook.
Like she's the other opposing faction.
The not queen.
The not queen. She's beautiful. Oh my gosh, she's so beautiful. She's so freaking beautiful. F that.
No comparison.
He got a big old crush, and so now he's choosing the wrong side. Actually, no,
for the right reason.
I actually like Rhaenyra too. I don't know. But the thing is, these are all terrible people, right? In the end, because
in the end, probably, yeah.
Like there's a lust for power on all sides, and there's a effort to like hide that behind all kinds of excuses and like quote unquote legitimacy. Like there's no legitimacy here. And something that I liked about the original Game of Thrones, like one of my favorite lines, which I can't remember exactly now, but like it basically goes like it's like near the end of the show. And do you remember how Jaime Lannister, he was working with that he was basically a mercenary type guy. Do you remember him?
Yeah.
I remember.
Yeah. He's like in a bar,
the Hound,
like near the end. What'd you say?
The Hound.
No, Jaime Lannister.
Okay.
No.
The guy who was missing a hand.
Oh, yeah.
So Jaime Lannister, he was working for a mercenary, and the mercenary is in a bar, and he's talking to someone else. I can't remember his name right now. I have to look it up. And he says that like, these kings, right? They were thieves beforehand, right? Like you look at me differently, but like these guys are just better killers than anyone else, right? It's like they hide behind this idea of like royalty and I guess like divine destiny, right? Like like the gods chose me. No, you were just better killers, right? You were better killers, and you killed enough until like you were on the throne, and then from there, you said you always meant to be there. And I love that look. I love that look at history, right?
Yeah.
You're just better killers. The Targaryens, right? What did they do? They just like showed up in Westeros like one day, 3 of them, and they just burned army after army after army until people stopped sending armies, and they're like, okay, we're kings. We're in charge now.
Yeah, but it was their destiny, Prime. It was a destiny.
Yeah, right.
God chose me.
Yeah. I mean, like the king of England, right? Like, what is his line? There was some killing, right? There was some thieving, and there was some killing, at some point in the past, and they just did it so much better than the other guys.
Yeah, that's interesting. Yeah, I agree.
But it is Rhaenyra's destiny. That is
okay. His lady love.
Yeah,
I'm not biased.
Sorry, distracted once again.
You're good.
Yeah. So you ready to get started?
Yeah. Are you guys streaming? You guys on?
I'm about to go live in a moment.
Okay, cool.
And
I'm streaming
on
by
the
the way.
link in the chat.
Okay. Cool.
1 second. Moment.
I mean, we can just get started now. We don't have to wait,
That's
right?
true. Yes. No.
Yeah.
Sorry.
All
I was
right.
ready.
Cool. All right, guys. Big news week on here, the Anti-Maha headquarters, your weekly science and news wrap up. I think there's just a lot of news, and honestly, that didn't really get into mainstream coverage, just because there's so much other news going on, obviously with Plattner and all that kind of stuff. But man, there was a lot in science and health this week. So first up, really the for the first story that we're having today, former CDC official describes the pure chaos of RFK Jr. sought to transform the health agency to take over a vaccine panel. So I just wanted to go over this first, just because of how it is such an example of how it permeates, and we're going to see in the coming stories just the problems that are coming because of this. A former top official at the CDC and prevention described, quote, pure chaos at the health agency as Health and Human Services Secretary RFK sought to drastically transform its policy and personnel. In an interview with Face the Nation with Margaret Brennan, airing Sunday, former CDC Chief Medical Officer Dr. Deborah Howery, who resigned from the agency in protest last summer alongside 3 other top officials, described the turmoil and concern inside the agency. Among the key issues, the June 9th, 2025 removal of experts from key vaccine advisory panels, as well as Kennedy's refusal to receive a briefing on the ongoing measles epidemic from the agency's top medical official. Which that in and of itself, I imagine us going through an unprecedented measles epidemic, and he literally just doesn't care. Misinformation he has spread about the measles vaccine, and his general refusal to recognize the facts that did not fit his agenda. Quote, science doesn't change based on who is office, so when things were happening, I knew this was different than before, she said in her first interview. And it's just, hey, Buckle, it's just wild to me how, from here, it started at the top, right? It started as soon as they came in, and if science has predictive qualities, like how are things going to be different, right? How are things going to be impacted from this? And it's just interesting. I feel like from the inside, they felt it at the very beginning. Within the first couple of months, within the CDC, they could see it coming, and they could see it happening, and people were already resigning about it.
Yeah. And what's well, there's many things interesting about this article, but let's say it's a little bit kind of like blackpilling, so to speak, because like at least from what I gather from the article in terms of like what they were saying, it's like they originally stuck around because they thought like, well, at least having some guidance here is probably better than nothing. Trying to at least do some good.
Mm-hmm.
But then at least from the tone of the article, what I got is like, well, she eventually like got hopeless, or like she couldn't stay in the institution while its integrity and pretty much everything is like being eroded, and she kind of like then was more or less like, well, had to, I guess, follow her conscience and like resign, which is not a good sign, obviously.
Yeah, exactly.
And then the fact that she also brought up of like, if I remember correctly from the article, of like she was understandably and I think valid criticism of RFK Jr. RFK Jr. had this criticism of these institutions, like they have all these conflict of interests, but then based off of what she described, based off of the article, is that all the appointees and I think RFK himself, they did not subject themselves to the proper vetting of like conflict of interest, or they did not fully disclose their potential conflict of interest. And so no surprise, the hypocrisy, basically.
Yeah, exactly. Yeah, completely unvetted, completely educated on these issues. I mean, and these people are she's an ER doctor. Spent 11 years at the CDC. I mean, so she is absolutely qualified in order to speak on this. But
yeah, if not who, I don't know who else would be, because as you said, longtime member of the CDC, and I think it's over a decade of ER experience, or like
Yeah.
clinical experience, if I remember correctly from the article.
Yeah, exactly. So real quick, and then I just wanted to preface this article, and then we can immediately go into what is actually happening. What are the problems? And then we have we have confirmation now this week. So the second story now. The second story is the Air Force trainee in San Antonio in Texas died from the flu. So we're already seeing, we have the unprofessionalism, the unseriousness of RFK Jr. coming in, changing all these things, changing the vaccine mandates. Pete Hegseth, who's honestly just a Saturday morning B Team Fox News host. He has no idea what he's doing. So he takes this and makes, they have a flu outbreak. And so now it is confirmed. The case of the death of the Air Force trainee who died last month at Lackland Air Force Base in San Antonio was influenza. That we covered it at the time, that outbreak, and sure enough, we know that that person died, and now there it is. So his obituary, the mortuary, the autopsy showed that apparently, according to the representative Joaquin Castro. So influenza swept the Air Force Base in June, 1 month after Defense Secretary Pete Hegseth made the flu shots voluntary rather than mandatory. Nearly 300 troops had been sickened by influenza. So it's already having an impact.
Yeah, and obviously tragic, for sure, and pretty much as highlighted in the article, almost certainly preventable. And it's like, I don't think we should let people forget about this moving forward. And
Mhm.
also, uh, how insensitive, should we be, or are we allowed to be, so to speak, in terms of you know, one of the talking points, at least what I heard, during the heights of the pandemic, it's like when people were pointing out the death toll, a lot of the from my perspective, at least from what I heard, is like a lot of the conservative talking points is like all the comorbidities. So like, oh well, these are people with comorbidities that are dying. Should we just hound the fact, or like should be asking the question? Would it be insensitive to ask, well, what's the comorbidity of this person here? As in, like, is it just comorbidities? As in, do they have a weak immune system? Or are they just not healthy, and therefore, like, is this a death that's not so tragic, or let's say to downplay it, as many people I think did during the pandemic? I don't think that would be a good thing, but I'm curious how they would react if we started doing that.
Yeah, exactly. Your thoughts, Prime? Like just already seeing the impact directly related. Now we know that this person actually did die of the flu.
Um. I mean, expected, right?
Yeah.
So there's not much to say there. I mean, like, don't take the flu vaccines, and then someone out of the large organization that is our military is going to die from the flu. Yeah, yeah, that kind of is what it is. I like what Corey was talking about. Where there's this whole discussion about comorbidities and how like, well, that just explains it. Well, I mean, they had something else, and so they died. Well, that was actually the point, right? That was one of the things that we um
You want to
that
protect the vulnerable.
Yeah.
the pro vaccine was talking. Yeah, the vulnerable. Yeah, what's another comorbidity? Like just being young or being old, right?
Mhm.
Like these are things that affect a person's ability to fight an infection. We know this, and so we try to make sure those individuals are protected themselves, and then have a sphere of protection around them for people less likely to pass on the virus, right? But like, oh, it was a comorbidity, so like it's like not that big of a deal. Like it wasn't COVID by itself, right? Like it's like searching for, and you've seen this before, right? Like uh there's a certain number of police shootings, right? People, of all races, frankly. And like what the media or conservatives who pretend to be pro cop will do is like, well, this person was no angel, right? You have to find the perfect victim, and then, well, maybe care about that, right? Like, oh, they did something wrong in their lives. They might have smoked weed at some point, right? Like, and so they were no angel, right? And I just relate this to this, like, oh well, they're not the perfect victim, the perfect patient. Something else was wrong with them, and so I guess it's not a big deal. So yeah, I just like the where Corey went with that.
And I would like to even push that, extend it even forward. Again, I don't think, I would hope that, we never let the other side forget, especially like, so from what I remember in terms of, Pete Hegseth's rhetoric about,
Mhm.
he's all about, having the most formidable, lethal military. And then I think that's one of the reasons why, I think he's largely against having women serve in the military. I think he sees them as weak, or like you can't have an effective, deadly military if it includes women.
Mhm.
But then, at least in my mind, you can make the argument of like, well, aren't these people then like, if you are recruiting like the most lethal and like healthiest recruits, how are they just falling ill to the flu, and then having one die, right?
Yeah.
Isn't that not, is not a testament to that their selection process must be up? Because they say that if you're healthy, you're pretty much not going to get sick, right? You have to rely on your immune system. So at least for me, the logic follows like, well,
Yeah,
like
this is
you you are
a
clearly not
selected
recruiting
population.
the healthiest
Yeah.
population. So how can you have the healthiest, deadliest military if like you're not selecting for the right people? You're not selecting for the healthy people, right? They don't need vaccines, because if you're healthy, you don't need a vaccine.
Yeah.
So you must
Yeah.
be selecting unhealthy people.
Or they're lying.
Yeah, this
That's
is
their thing. That in their mind, you're only sick if you're lying and you're a bad person. So I guess they're only
Exactly.
taking it.
But we have 300 people, so that's quite a bit of people.
Yeah.
It's like you're letting all these
yeah.
unhealthy people with defective immune systems in. How
Well,
does that square with the most lethal, deadly military?
well, yeah, this is selected population, and like you would expect that among the military, you would have averaged out, right? Just a more healthy, fit portion of the population than represented in average, right? Um people who are a bit more hardy. But like yeah, like it doesn't matter, like if you can run a mile or two, right? Like with a heavy a backpack or something. Like yeah, your microbes are still going to do what they do. That's your body, right?
Yeah.
I mean, I
Like,
agree with that. I know that, but they
yeah,
make a
yeah.
case against that.
But I just but you would think that like among the like if this population cannot fight this off and you know be like have better outcomes, then like what can you expect of more vulnerable populations, which
True,
is like
absolutely.
everybody else, or someone that they care about. So that person, like yes, you have the army uh soldier, whatever, right?
Mhm.
Army member. He's as healthy as RFK, the way he's healthy in the way that RFK defines it, right? And that like, well, yes, he gets these sicknesses, but he's able to fight them off, right? Um, his immune system, has gotten used to it or whatever, right? Like he's like, he's now self immune, but this person leaves the base and then interacts with like the people he cares about, which would include people who are vulnerable, maybe his mother, who's like in the hospital for some chronic disease, right? Like or other people within that hospital as well, as he's passing by. This individual can still spread it. I mean, like, I don't, unless I'm missing something, RFK doesn't think that like diseases spread are like communicable in the way that we understand them to be communicable. That's a possibility too. Who knows, right? But
I
if
think
they're
he's crazy, but not
communicable,
that crazy. I think he believes in communicable, but you
yeah,
would not surprised if he has some weird ideas about other things. But I think
yeah. But like, if these things are still communicable, right? If you can still be infectious, even if you're not showing symptoms and not succumbing to it, right? Well, then it would still follow that you could that healthy person, unless they are only around other people as healthy, would still like go to populations that he understands are vulnerable.
Yeah.
I don't know.
Yeah, it
Yeah.
is. Especially in an all volunteer service, so you need as many people that they possibly want. And my frustration with like writing off people that have um, lost the genetic lottery or have another disease that puts them immune compromised or something like that. It's just like, how is that a feeling of freedom? You know, that if I get to a certain
I agree.
period, a certain age, I'm not going to be like welcomed into retirement. I'm going to be shuttled off to the slaughterhouse, because it's, I have to die for the
Just
economy.
self-quarantine for the rest of your days.
Yeah,
No problem.
exactly. So it's like you don't really feel liberated in that society, but it's not just he's not just having an impact here, right? We see, and Prime is right. Like the vaccine is completely, it helps mitigate the most dangerous outcomes of a viral infection. And we have another one where um these parents are basically in this Maha movement for our next article, are basically being told wrongly that the vitamin K shot that is given to babies as they get into the world, basically they don't have the clotting factors that they need in order to stop a brain bleed. So what we found is that we give them a shot of vitamin K as opposed to giving them a blood transfusion later. It's a lot safer. It's a lot safer. You can actually stop the brain bleed as it's happening. You don't have to worry about a lot of other impacts on that. So Maha is basically created this idea that you can that as soon as they come out of the womb, now they're pumping them full of these toxins and that kind of stuff, and you have to stop everything. And they think that the vitamin K shot is a vaccine erroneously. So now
Mhm.
you have people saying no to this, which is a huge problem. Doctors, as parents reject vitamin K shots, some babies develop devastating bleeding. Doctors described treating Blaine and abdominal hemorrhages in infants who hadn't received the routine injection. Several said that the images of those patients were seared in their minds. When the mother arrived with her newborn, blood oozing from the umbilical cord stump, Dr. Jessica Kirk and a nurse were alone in a small pediatric emergency room in Florida. After 2 decades in medicine, Dr. Kirk, a pediatric hospitalist now practicing in Alabama, usually has an idea of possible diagnoses within moments of meeting a patient, but she hadn't seen this before. As the nurse took vital signs, Dr. Kirk called her medical director. Oh no, she recalled the director saying upon hearing the child's name. The parents, the director said, had declined the vitamin K injection newborns routinely receive to help blood clots. Without it, infants are vulnerable to spontaneous bleeding. This baby was hemorrhaging internally. Within minutes, he was cold, high pulse, blood pressure low. Dr. Kirk recalled she gave IV fluids, an emergency dose of vitamin K, so it wound up having to get the vitamin K shot anyway, and a plasma transfusion, all while trying to arrange a transfer to a neonatal intensive care unit. Shout out to the NICU nurses. The
Absolutely.
baby's abdomen became firm from blood flooding into it. He started to fade out of consciousness. And just the stats now. So it was 2021, and the number of parents refusing the vitamin K shot had begun to increase quietly enough that encountering a baby who hadn't received it still shocked Dr. Kirk. Now many doctors see it regularly, and bleeding cases are accumulating. A study of electric medical records found that 5.2% of babies in the U.S. went without a shot in 2024, up from 2.9% in 2017, meaning tens of thousands more unprotected babies. And more than 15 doctors told the New York Times they had observed a further increase in the past 2 years. The resulting hemorrhages aren't tracked nationally, but experts estimate as many as 1 in 60 untreated infants, 1.7%, will suffer a bleed in the first week of life, and another fraction of percent within 6 months. So this is going up and up. We have almost
Almost
nearly
a doubling of
doubling.
the percentage.
Yeah,
Almost.
yeah.
Almost.
Which is like preventable. People didn't even see this before. This wasn't even a thing that physicians were even seeing, and now they're seeing it. That 1 in 60 untreated infants.
Yeah, and there was, so obviously a very sad story and sad state of affairs, and there was a lot of very harrowing descriptions in the article. Unfortunately, well, understandably trying to uh, paint the reality of the consequences of people rejecting or parents rejecting the vitamin K shot for their newborn infant. But there's, at least in my mind, there's an interesting paragraph at the end that when I read it, I had somewhat mixed feelings about it, and I'm curious how you guys feel about it. So I'm going to read
Mm-hmm.
it as in, so it's just like the last paragraph or so, or like technically last three. But Dr. Kirk meets many parents on the worst days of their lives. She looks them in the eye. She said, and tells them, "quote I just want you to hear this from me and remember my voice saying this to you. This is not your fault. There's no way you could have seen this coming. There's nothing you could have done differently." End quote. And then it goes on to, in closing, she looked this mother in the eye and told her it wasn't her fault. She meant it. She knew the woman had believed she was acting in her child's best interests. And then another quote from the doctor. But what I could not bring myself to say to her was, there's nothing you could have done, Dr. Kirk said. I just couldn't say it. And at least for me, and I might just be misinterpreting, but so
Mm-hmm.
I think I understand the sentiment of the doctor. Like they're trying to understandably be compassionate, as in like in the doctor's mind, they can understand like in from the parents' belief perspective, the genuine belief, like they were acting with good intentions, as in they believed, they had the true belief that the vitamin K shot was a bad thing, and so they made the decision. And therefore that's why she says to the parents like there's nothing you could have done differently, but then she like revises it, or she says that what she can't say is that there's nothing you could have done. But even that framing itself, like, and I understand, it's, let's say, where is it appropriate to like blame parents for whatever quote unquote genuine false beliefs. But I don't know, I find, yeah, I go back and forth on like, is that an appropriate
I
response, like.
I feel like so I had to read that paragraph a few times actually because I felt like I was misunderstanding something. And I think you're running into a similar issue. One,
Mm.
the first quote when she like that spiel she usually gives to parents, I think that's just like any group of parents, right? Like
That
their
followed
child
medical.
could have like yeah, like all of them, right? Like the child could have fallen any number of illnesses, right? Maybe a genetic disorder or whatever, right? Or something, right? That like hey, and or just things happen to babies. That's unfortunate. Things happen to children. It's really unfortunate, but like life happens to them, and then that speech is appropriate for them. Like, hey, like you were just trying to do your best. You were just trying to manage them the best, and there's nothing you could have done, right? And this is not your fault. That's probably appropriate for like most people who come through there. But
Yeah.
then like so that part's bracketed off, right? But it's not so obvious in the paragraph. And then she's transitioning to the other parent, the woman that's in front of her, right? Earlier, it talks about how she like this woman is watching the doctors, white faced, as they're trying to save her baby's life, right? um and like for her she can't say like this is not your fault or you could have done something could have done better, right? Like she's making a distinction that you're not that this woman is not like those other parents. This was foreseeable, right?
Yeah.
Like I mean, I don't know what like medical advice this particular woman was given, who was part of this anecdote, but like assuming that like the medical staff did their job, right, and like let her know, hey, I understand you're trying to refuse this shot, this medication, but like if you don't, these are the possible consequences, right? In that case, yeah, she fucked up. She made the wrong choice. The article in another area talks about like what we all know, what we've discussed before, that so many of these parents end up in like who are concerned and want to do the right thing, and who are looking for advice, end up in Facebook groups, right, taking advice from a whole other set of idiots. Like maybe these random people aren't the best source font of information, right? These random people you don't know, whose like level of expertise in this is questionable at best, usually none at all, and or just like you're hearing rumors, right? Like, okay, there's so many things I want to say here, because this article was, I think, affecting me as well, right? Like I feel like this had a big impact on all of us. This article is a powerful one. So shout out to, was the New York Times was yeah. Shout out to them for this article. It's really good. But like I was thinking of this in another context, in the political context earlier today, right? But like it's important to have frameworks, right? Frameworks within your mind to like understand the world around you, to piece that together. And that comes through like educating yourself, right? To putting in effort to to understand, like, especially like critical aspects of life. Um, like if you don't have a framework, right, then you'll fall for anything. So like I don't have like a framework for like cars, like I'm not a big car guy.
Neither am I.
And so like I can be convinced of like lots of things about cars, right? If you say it with an authoritative way, right? I can be convinced. But that's because I don't have a basic framework. Now, a framework doesn't mean that you understand everything, right? Like you can't, right? Like for individuals, especially if you don't work in those fields, you can't understand it. But like you know enough, right, to like parse information. That's what the framework allows you to do, to parse that information. If you don't have a framework in politics, well then like anything a person tells you, yeah, you'll believe, you'll like fall for the dumbest things. Same thing for medical advice. Like I feel like a lot of these people like don't have a basic framework for medicine, because then you might think like, well, it might be a good idea to take this shot, right? Even if you have some questions, right? Questions you can ask a medical professional. They're right there. You're in the hospital with them, right? You can ask, and you begin. It's a good place to start investigating, right? But like if you don't even know where to start your questions, right, or like where to, like what to ask, then yeah, you'll fall for this. And so like I can imagine this mother, right, saying no because she doesn't have a framework. Like she could have easily just heard, like she might not have end up in those Facebook groups, right, but someone else who had been there, who had been part of this movement or whatever, right, could have said a thing. She could have heard a few whispers, right? She could have heard she could have just like there's a general like it's generally within the zeitgeist, right, that like vaccines are bad. If you're a type of person who doesn't pay attention to any of these things, right, who's not like part of Maha, right, but who just like absorbs these things passively, like through osmosis, then like you can walk away. Yeah, vaccines, I don't know, man. Like it's a little sketchy. I think I'll just go without. So even without actually like engaging with that content, she could have actually taken that in. And because she doesn't have a framework to process, right, this stray bits of information, she makes a critical decision for her child who needed them to protect them and to make like good decisions. She makes a critical mistake there, and yeah, it was your fault.
I think so.
But
I think it's
but that's the
neglect.
thing.
I think it's neglect.
So
I do. I think it's
that's
criminal
where
neglect. I don't know.
so that's where, so I think I understand how you recontextualize like those last three paragraphs, Prime. And like
No.
I agree with your assessment in terms of like that last part, like the doctor is not saying to that particular mother who, let's say, made the bad decision of like she's not saying there's nothing you could have done, but she's, at least from how I'm interpreting the article, of like that middle paragraph when she said she looked this mother in the eye and told her it wasn't her fault. That's what I have. That's where most of my mixed feelings stem from. Of like, is uh, like, so I understand definitely. Like, is it a place for the doctor to like start whatever finger pointing at the parent in that moment? Probably not. Like, I understand maybe in that moment, trying to be compassionate, but like, is that the right response?
Is there nothing you could have done? Yeah.
I mean,
Or like
I mean,
it's obvious.
like
Like the problem is that it's I think it's criminal neglect. Personally, I think that you're
I
neglecting
lean
to
towards
protect
that,
your
but
child. I think that you're
I'm pretty
protect
mixed on it.
like okay. Let's think about this then. Okay, if it's 1 in 60 untreated infants that are having a bleed, a hemorrhaging. Okay, 1.7%. Imagine a scenario that is 5%, 10%, 50%. 100%. 100% of the time, the child is going to bleed and hemorrhage, and it could cost them their life. And you deny that medicine. Surely we can say that that's neglect, right? That
That
would
would
be
make it. I
that's
already
like
lean towards your position, but
that
that would
would
make
be
it
like
stronger for
that'd
me.
be like throwing a kid into a pool that doesn't know how to swim. Like we obviously, like, you failed to neglect, like, you to save that child, and you knew that was going to happen. But like, what is, if it's 100% that we know, and like, where is the line? Like, what is the line where it's like actually still neglect when we have so much data to support it? Like 50%? I mean, if I was to have my kid learn how to ride a bike on a busy road, like, how could anyone ever have seen that anyone would run over my child? How could anyone have known that would have happened? It's like, well, what are you talking
Well,
about?
so
Like, that
I
happens
understand
all
what
the
you're
time
saying,
there.
but to let's say, and again, I lean towards your position. I'm not like quite 100% there, but like uh to let's say somewhat steelman the other side of like, yeah, the playing in traffic, like, as opposed, because like, for, as I think Prime pointed out, like, this aspect of framework of like, due to how people generally go about their daily lives, just like, they have a framework of how traffic works and how cars interact with people, as opposed to a doctor saying, "Hey, your child needs a vitamin K shot." I would suspect probably even like half, if not most people, don't even know what vitamin K is, how it's important for clotting. They might even think that vitamin K is not a thing; it's just made up. Or vitamin K might be street for ketamine. I don't know, but like,
I kept thinking a special K, which, yeah, that's the,
So would
yeah,
it be
that's
okay?
whatever.
So would it be okay if, like, a human that had never seen a car before to go into, like, a road? And I don't know. I'm trying to think of an analogy here.
I would be
It
more
it
charitable to that, like, but that's where, but again, to be clear, like, for me, the issue step, not the issue, but like what leads me towards like, pretty much, well, yeah, like, more being more active and saying like, or being able to say like, this is the parent's fault, okay, but like, uh, yeah, I think. uh, I'm trying to think in terms of like, yeah, what's like the perfect analogy, which I don't think like there is one. Like, it seems like it's a very unique situation. Like a parent that has like, is going on faith, but like, here is where it's like, the parent is going against like, who should be, generally speaking, although there are obviously exceptions, but like, they're going against the qualified expert opinion, right?
exactly.
Uh, and that's where it's like, at least that's where like, it breaks down for me. That's like the person where I think Prime brought up a good analogy of like, I have no framework of how cars work, and that's why, not that I have a car, but like, if I would ever take my car to a mechanic, I would more or less have no choice but to like trust the mechanic, unless I'm actually going to do the due diligence and the footwork and the effort to like vet what they're saying. I'm just gonna be like, hey, if this is what you say the problem is, I'm more or less going to follow your lead. Or like, if I have any sort of suspicions, I will go to another mechanic and maybe get a second opinion.
But like,
That's
negligence
where
of the
things.
law just isn't it. Negligence of the law isn't an excuse. Like, okay, here is criminal neglect in the United States as we define it. Criminal neglect or criminal negligence is a culpable mental state where a person fails to perceive a substantial and unjustifiable risk that their conduct or failure to act will cause harm, when that failure constitute a gross deviation from the standard of care a reasonable person would observe. So this is a gross deviation from the standard of care that would normally be given by qualified medical professionals. These people are coming in and saying, I can do this. I can make these decisions, and these kids are being harmed because of it. I really do feel like the big problem here is that we are coddling anti-vax sentiment way too much in our societies. We are letting these people make these decisions,
I largely
and
agree with you
the
there. Yeah,
kids are
but
not
then,
consenting. The kids do not consent to be
but
an experiment for their parents to be shaman or
I don't
whatever
disagree.
they're
But then
being.
would you go so far as to like pretty much as in like it's to make it like it has to it's legally mandatory, as in parents can't refuse it.
Okay, so here's the thing. This is the actual real thing. You don't have to consent to a vitamin K shot. That because it's not a vaccine. So just in the same way that you don't have to consent to have when you have open heart surgery to have do I have to, can I cut here? Can I cut here? Can I cut here? No, we're doing the surgery, dude. We're gonna have the surgery and we're gonna do the surgery on you. When you sign the line, we're gonna get that done. So you don't get to consent on things. And these nurses don't actually have to get consent from the parents in order to do the vitamin K shot. They could say they can say I'm not, I don't want the vitamin K shot, and the nurse could be like, all right, whatever, boom, done. It's already done. It doesn't matter. So it's actually it does. They don't need to
But
get
out of
consent.
curiosity, how like so is it the case? I'm ignorant on this, but like, is it the case that in the circumstance in the circumstances where the children or the newborn babies are not getting the vitamin K, do you know if that's largely the result of like the parents actively intervening of like they
Yes.
request it?
Yes, they have to
Okay.
be actively intervening and be there, and like have a nurse that is susceptible or are willing to like do this, because the nurse could just be like, no, I'm not, I refuse to
Well,
do
if
this, and
that's
I'm going to
true,
give it
then
anyway.
arguably it's the medical professionals at fault if that's the
Yes,
case.
this is a big thing. This is I don't understand why, like, and someone in my family has had this happen where the nurse is like, "Oh, it's a vitamin K shot. Let's go see what how the parents agree with it, if they agree with it or not." And they're like, "What are you talking about? Why are we asking them whether or not they need to have the vitamin K shot when we can just do it right now, like for the best of the patient? Our patient needs the best medical care possible, and by denying them that, they're actually doing harm. The medical professional is 1% of the
So
time they're doing harm."
I don't know. I feel like I disagree with this. Maybe my mind can be changed on this, but um, I understand where you're going with this, saying that like, hey, this is basic medical care, and why even deny them? Why should it be up for a question, right? Um, we usually don't check in with for everything, right? We just say like, okay, well, hey, well, like you came to us to deliver your baby and do like standard post birth care, right? And so like along those lines, just like with you, like you give the example of surgery, right? We don't then check in with you every step of the way to like get your okay when you aren't an expert in any of this. So I understand like your logic here. Um, but like, what about like something that the medical professionals think is necessary and just like good care, but like there is reasonable reason to believe otherwise, right? Like for instance, circumcision, right? Circumcision is just standard here in the States.
Well, the states is
In most
pretty
hospitals.
special in that regard.
I think that
Yeah,
I think circumcision is genital mutilation. I think that's a separate issue, because
I agree.
that's not a medical necessary
I
thing.
know I agree,
Hmm.
but right, the people who are pro circumcision will tell you, well, like that helps like with uh protect against infections, because that area is so hard to clean, and so like this is good for like the general well-being of the child. And if they honestly believe that, right, and then circumcise your child without you knowing, right? Or you specifically say, Dr. Greg, you say, hey, I don't want my child circumcised. And they're like, and then do it anyway, like you suggested for the special, for the vitamin K. Then like that would be a big problem for you, right? Again, I'm on your side in terms of like the what circumcisions are. It's disgusting practice. But like those other people, they don't feel like it's a disgusting practice. They think they're doing right by the child. So like, oh, in this case, like you would say they should check in with the parent, right? Well, then,
Well, yeah, of course they do,
like
and they do. They don't.
other parents would feel the same way about the shot, though.
I mean, but one protects you from like something that has known harm, versus the other one is a cosmetic theological
They don't think it's
mutilation
just
thing.
that. They think it's a medical protection, though,
Yeah,
right? Like,
yeah. So it's
some of
like,
them are theological, but others are.
yeah. So it's like it's just completely different. I mean, there's yeah. I understand what you're saying. Where some people think that it's as important as that, but it's just there are facts of the matter. That's the thing. That there are just facts of the matter where you can't just, I don't know. It's just
I get that there are facts, but then now you're saying, well, this other person gets to adjudicate those facts, and like the parents simply aren't involved, and whatever decision they're going to make, like this, are going to have a lifetime of effects on this child, right?
no,
And
not the
so like I
vitamin
don't
K
think
shot.
there's my problem is like I just don't think there's a simple answer, right? I don't think there's a simple answer as to say that like, well,
I
yeah, the
agree.
medical professionals are simply right, and then they are allowed to do whatever to the child, right? Or that the parents are necessarily right. And the way that we've like, we've landed here currently in this timeline, right, is that like, well, we default to parents, we default to the caregivers, okay, like do you consent to this thing, and then we go from there. It has clearly there are disastrous consequences, I agree, right? But like in for instance, like in a country, right, that has a history of medical racism, yeah, actually I want a check-in, right? Like I don't necessarily trust the medical establishment like blindingly, right? They have proven um that they can't be trusted. Like I and not just for like, big conspiracy things, right? Like, there are, yeah, like having worked in a hospital, right? I've heard from other people, right? Like what, like those like nurses who are working on the floors think about their patients, right? The patients who come from like a majority black neighborhoods, how they talk about them, what they say, right? Do I want to put my hands and my health in their hands uncritically? No, actually, right? It just appear like I'm not going to assume the worst of my of the medical team that's either taking care of me or a family member, but yeah, I'm going to be critical of everything, right? Because you just have to be. Like the person who lives with the consequences is you, right? Not them, you, right?
No,
I mean,
no,
so
you don't get to
right.
make a medical decision, because in these scenarios, when you don't have the license to make them, the decision is being and will be made by the medical professional, or they just won't touch you, and they'll say you can leave without medical agreement, and you can sign the agreement that says that you're probably going to perish after this, and that's what it is. I mean, that
Sure. What about What about medication? So, like, so I mean, this is an example, right? So, this is more of a one-to-one example. Okay, medication. So, in terms of the okay, I keep saying special K, not special K. Uh, it's vitamin K, right?
mhm.
I'm the one that
And
introduced the
vitamin.
ketamine angle, so it's all my fault.
No, no, no. But I was thinking of it previously. I was thinking of that. Um, yeah. So we're talking about vitamin K here, but there's all kinds of like medication that can have like um uh side effects, right? Ones that have a low chance of side effects, but they can say, well, this is the best for you. But doctors can be wrong, right? They can be sure of that this is the proper treatment plan, but then they just could be wrong, right? And if you had gotten a second opinion, you would have maybe found that out. Well, okay. Well, if you're saying that Well, you don't get a choice. But then are you saying that a doctor should be able to prescribe a medication or some sort of treatment plan, and then you have to go down that route? There's no choice there.
I mean, on some of them where it's the best case scenario where your life could or your kid could die. Yeah,
Who decides that?
the
Who
medical
decides that
professional
though?
that
You're saying
understands
your
that.
but you're saying kid because kids is easier, right? Because it's saying, oh well, you're being negligent to a child. So I'm trying to take it away, even move away from that, right? Just say, hey, like we're talking about adults here. We're talking about adults. Adults trying to navigate the medical field, right? There is such a thing as medical injury that does happen in the world. And so like should doctors have the ultimate power to force treatment on an individual?
If they're getting medical treatment there at a hospital, yes,
Well, just to clarify, as in like, uh, is
they're
it more
licensed.
if I'm
They're
yeah,
licensed
but if
by
I'm
the state. So
I understand.
it is like
Well,
if they are not doing the best, like they are not experimenting on you. Cops, I mean, physicians aren't experimenting on you. They're doing the best action that they know to do based on scientific literature and studies that we have. So yes, so they either follow that line, that decision tree, or they are not doing their right by that patient, and they lose their license for that. That's why we
And
removed
you
the
might lose your
licenses for
life
the
if they're
physicians
wrong,
that spread
right?
misinformation during COVID, for
uh,
They
example.
lose their license, you lose your life though. Right? Like those are the stakes.
Yeah.
and again,
Yeah,
just to
and
clarify,
everyone is capable of going in and not going seeking medical care and staying at home. And if you think that you are the best possible person to make these decisions, then just stay at home.
okay, well, I need to, I want to like to clarify. Are you is because if I'm understanding it correctly, it sounds like a binary. Like if you walk into a hospital and saying, "Hey, I'm looking for medical treatment," it sounds like, but correct me if I'm mistaken, of like then you're surrendering to the system, and you have to have faith in the system, and then like
Yes.
just let them do their work.
Yes,
Okay,
you can't.
that's
This is so, but like you guys don't understand. I don't think like how banal and easy and small this is. Like
no,
in the terms of this,
I
it
understand.
would be like I don't like iodine. I don't like sanitizing. Like my thing when you go into surgery, don't wear a mask. Just I don't really care about I'm not worried about like iodine. I want you to take that away, and that's extremely dangerous. That's you wouldn't the medical
Yeah,
professional wouldn't be doing that.
I don't disagree, but like here's where like I think you're being like too black and white. Because let's say for I can ground it in an actual example, okay, of like at least in Canada, okay, although I think it's largely tracks in the states of like let's say for your typical endoscopy, okay, in Canada. When I say endoscopy, I guess I'll be more specific. A colonoscopy in Canada, okay. Your typical sedation is some fentanyl and some sort of sedative. I think Valium or Versed is probably like the most common one. But like, uh, technically, you can perform a colonoscopy, and like it should be an option to like refuse like the fentanyl or like the Versed if you don't want to be like sedated to that extent. And but you're saying that should not be an option because like
You guys you
uh,
guys are
a
comparing
gastro
this to like things that are like that are 95.5, and like these
I know, but
this is
that's why I clarified. That's why I clarified.
99.99999%. Like
That's why
this
I
is
clarified if it's a binary for you
it,
like that. I'm trying
there
to tease out because then it's not a binary. It's like because
it is
that's
in that you
why
either make the right decision by your parent by for the kid, or you don't. And if you don't make that kid that the decision by the parent by the kid, I think that it's neglect. The like what do you think that we have neglect for? Like as a like you know what I mean? Like how could anyone be charged with this if you think that
I
there
agree
would never
medical
be?
neglect is a thing. Like I think Corey, you and I both agree that medical
yeah.
neglect is a thing and probably should be a
But I
thing.
think we're also on the
Why?
same page. That
Why? How
as
do
far as
you
I can tell,
know? How you
but
don't think that people
yeah,
just get better without
yeah,
any
yeah,
medical intervention?
sure, but let me just clarify. So, and again, I'm ignorant, but as far as you know, Greg, like is there like is there an increase in cases? Because like based off of like how you're framing it is like, and like in some sense I agree with you, like these parents should be charged for negligence, right?
I think at some point, yes, absolutely.
But then what? But then my question is like, well, why are they not being charged for negligence? There has to be some sort of reason for
Because
that.
this
I'm
is
not saying
so
those are good
new
reasons,
that
but
it's kind of like this thing that people didn't envision, that there would be this many people that would be making this poor of decision. But now 1 out of every 60 untreated kids is now having a hemorrhage that could be, life ending. That could be, like that is wild.
I agree
Yeah,
that that's horrific. Absolutely.
I th- I think God, I'm not a lawyer, so there's gonna
How
be a
dare you
lawyer in
not be a
audience
lawyer?
who's gonna say that Prime doesn't know what the hell he's talking about, and I accept your criticism beforehand. Okay, I'll start there, right? But it seems like in terms of neglect, right, medical neglect, it would probably be something of um like an acute emergency that like, hey, your kid is like, okay, like these kids are hemorrhaging now, right? They're bleeding, like, and you don't take them to the hospital. Instead, like, let's have a prayer circle, right? That's a clear case of medical neglect, and I think that's what I imagine. Again, I'm not a lawyer, sorry, but like I imagine that's what those things usually look like. Your child comes down with some sort of heavy fever, they're freaking delirious, right? But you're like, no, it'll be fine, right? And you don't actually take them to get proper medical care. That's probably what medical neglect looks like. Not so much with these like decisions that like aren't like a you know don't take place during an emergency situation. Um, I and like, and I don't know how you can have it be otherwise. Like, I'm just like people like should be able to make uh medical choices. Like, okay, like I'm trying to think of some other like good examples of this. Like
I just looked up
uh
so
okay.
basically, um uh criminal neglect for medical applications. We have clinician failures, but then what we're really talking about is withholding medical care. Faith healing, so faith healing things, where you're failing to seek treatment for diabetic sepsis, untreated child infection in a child, failure to obtain care for an elderly patient, or a parent with pressure ulcers or malnutrition, withholding insulin, seizure medication, or chemotherapy from a dependent. Um, so yeah, I mean, obviously nobody's been charged with criminal neglect for vaccines or vitamin K. But what I'm saying is that I could understand in a scenario, especially with vaccines, or like us in um an outbreak or something like that. At some point, man, at some point, like it has to. It, the harm is out there, and it's known, and I feel like
I agree.
endangering a
Like
child,
I
you're
I
just endangering your
I believe
child.
I'm the one that brought up that I took issue with this doctor not pretty much saying like, "Hey, to the parents, not your fault."
Yeah.
I think there's a case to be made there. So it's like I'm sympathetic, but but yeah, it's hard for me to parse out of like where is the line of like when is it okay to have like a or when is it permissible and it's not criticizable to have like a genuine false belief. Like if I push it to the extreme of like if for whatever reason, due to some crazy algorithm or some crazy Facebook groups, like a parent had the genuine belief, like the genuine sincere belief that deep frying their baby was a good thing.
Yeah.
Okay,
Yeah,
it's like
exactly.
yeah,
It
like
doesn't matter.
if
Yeah.
they end up doing that,
Yeah.
and would I be okay with the doctor saying, "Hey, it's not your fault. You just didn't know any better"? I'd be like, "That's kind of dumb. Like you should know that deep frying your baby." But like I say, you should know. But like I don't know what their algorithm was being fed to their brain or how the brain works. But like I can imagine a scenario of like some deranged person or just like the right circumstances. They just think like, yeah,
Well,
deep frying their
we
baby is a
can have a more grounded example, right? Blood transfusions. that like
True.
we have medical, or I'm sorry, a religious sects that think blood transfusion is against their god or whatever the hell, right? And so they refuse it. And if the patient happens to be their child, they might refuse it, right? So like, what should be done there? Now, like what should, like I would say that that child absolutely deserves um blood, but like that would happen almost certainly within a an emergency situation, right? Like the child's losing a lot of blood, right? And we don't have time for negotiations. But like outside of that situation, like I don't know if we can force these things on people. Like in a an emergency situation, it all makes sense, right? Like, hey, like we gotta, like, you don't understand how this works. This, I'm not gonna let my patient die, right? Like the doctor shouldn't let their patient die on their operating table or whatever. Then maybe they should take that emergency action. But outside of that, I mean, if I don't know all the reasons why a person would get a blood transfusion. I'm sure there's ones where like it's a non-emergency, right? They for as some sort of some sort of treatment plan. Okay, right? It's a treatment plan. It's something they need, but like, hey man, this person is ambulatory, um, and like conscious and can make their decisions. Should they be able to walk out and refuse that treatment? Like, even though they'll need it, there'll be consequences if they don't. Yeah, they should be able to,
Yeah, just like
right?
someone skipping out on dialysis. Like you can do that for maybe a day or two, but at some point, if you don't get it, you're gonna die or be dire consequences.
We can bring the blood transfusion example to the vitamin K shot. The hemorrhaging causes them to lose blood so that they get a blood transfusion, and
Yeah.
they have to get. And at that point, the medical professionals don't have to get consent in order. They get informed consent from the patient, but no, they're going to do the blood transfusion because the person's going to die.
That's an
So it's like
emergency
it's going to
situation.
happen.
Agreed.
So
Emergency situation.
yeah. So it's
But
like if they don't do anything, the person is going to lose their life. So do you know what I mean?
no, that's what I'm saying. Yeah, an
Yeah.
emergency situation, right? Yeah, the person's going. I mean, this is the example I brought up. Yeah.
Yeah.
But like when the child has just been, just been given birth, right? They, well, I mean, they can be, but like in these cases, they're not an emergency situation, and like choices, and then there's a series of steps, series of medical treatments, that are standard, that we put these children through. Which as far as I agree with almost all of them, except for genital mutilation. Fuck that, right?
Mhm.
Hmm.
But like, yeah, other than that, off the top of my head, I can't think of anything else that I would push back on. But these are all choices. These are all choices. Again, I'm not saying this is easy, right? Like
Yeah.
I'm torn on this, right? Like I want to, um, I want to disincentivize parents from making these awful choices, these dumb choices, like you've been pointing out, Dr. Craig, right? But like my problem is like there is a line where um, institutional power, right, needs to give way to like personal freedom,
Mhm.
or like uh, disasters take place, right? Like if we just simply hand power to institutions blindly, right, and give them the power to punish people for not uh, you know obeying, really, um, that gives a small group of people a lot of power over other people's lives. You can say lots of things are medically
But that's what
necessary,
that is.
right?
That's what the
And lots of
medical
things,
license is. That is what it is. That literally an
no, it doesn't give
MD.
me power. No, no.
Yes,
A
it
medical license
does.
doesn't give power over my life. No,
Yes, it
actually,
does
no,
to
they
make
don't
decisions
actually have
for your
that.
life
No,
when
it
you.
doesn't.
It
No,
does.
it doesn't.
It does.
No, it
It
doesn't, Dr.
does
Craig.
in the
I can go to a hospital and I can decide to submit myself to any number of things, right? But like the moment I go in and ask for help, I don't lose all agency. That's just not how that works, and it's
Yes,
not
it
how it should
does.
work.
If you are under sedation, then yes, they're going to make the best possible decision for you.
That, yes,
and that's
I don't
saying,
have agency at that point, but when I do have agency,
yes,
when I can make decisions, then I should be able to make decisions,
but that's my
right?
point.
Like I should be able. Okay,
My
well,
my
that's
po-
not your point.
my point is that, like, we as a society and as a state give people this power through the licensing procedure. That is what that's what it does. And that's
Okay.
why we remove it for people that are criminally that are not following the best course forward. And that's why we remove that, because it's like we have given too much power to the wrong person to actually harm someone when they are vulnerable, right? When they can't make decisions for themselves, and we are relying on medical professionals to do the best thing possible.
Yeah, but so in my mind that is disanalogous, because like, yeah, it's a unique situation with a parent or guardian, like, and a child, because it's like I understand, I think the point that you're trying to make, Greg, of like, if a person is incapacitated, or they're unconscious and they can't make medical decisions, then like you have no choice but to put your faith in the system. Okay, but like assuming the parent is conscious, it's like, well, then they can intervene. I'm not saying they should. Again, I'm against parents making bad decisions. But like, uh, yeah, but the claim, it's also interesting, like, that the license more or less gives them ultimate power over your life. That seems like, I don't know, a bridge too far.
They're
Like,
going to make the best scenario, the best decision for your
when,
life at
yeah,
that time.
when you're in an emergency situation, correct? Is
Yes,
that like
yes, yes,
yes, that is the qualifier. But like,
yes.
in the vitamin K scenario, that's not the case, though. At least that we're not
That
in
is
that
no,
situation.
it is. That is the best possible scenario for you at that time.
But we have a presumably conscious parent that can make a decision.
But you can't. But
And
you're interjecting risk into a scenario where you don't understand the risks. So that's the problem. Is that it's like
But
is
yeah,
it
but yeah,
like in a scenario like you can get charged with murder even without actually murdering someone. You could all the way up to the actual thing. I don't have to pull the trigger in order to get called, charged with it. If I if I premeditate it, if I load the chamber, if I have you in things, you can get, there can be things that happen up into that moment, and you can't going down that line and just being like, well, the kid didn't survive this time. It's like, you were criminally like negligent in pushing it that far to begin with. Like like babies like drowning. Like, oh well, I just we were hanging out at the pool, and yeah, sure, the 1-year-old doesn't know how to swim, but we were hanging out, and you know what? It was bobbing up and down for a little bit. It figured out how to do it, and it didn't die this time. And you're like, well, what? Like, what are you talking about? Like, it- that is the
yeah,
scenario. That's actually the analogy in my mind that makes the most sense to be
I think I
talking
understand,
about.
but that's like, and this is where it's even difficult for me. That's why, again, like, I have a very conflicted feelings, but like I lean towards like this being like negligent. But like, you are from, and correct me if I'm wrong, but like, you are coming from the place of like, arguably being too informed, as in like, too much, because you have a framework of how this works, as opposed to like the parent with a drowning child, as Prime pointed out, I think correctly, of like, they have a framework, should be largely due to their experience of like how water interacts with your breathing capability and all that stuff, and swimming, versus, again, something abstract as a vitamin K shot, and do I inject this into my child? Like, that is arguably like a foreign concept to many, if not most, people or parents. Like, I understand, I know that you know the realities, and I know it, and I'm confident Prime knows and recognizes it as well. And so like, we're operating from the framework of like, whatever the appropriate framework. Uh, but like,
But
with the with
you can't go to a lifeguard and say, "My kid's fine. Water doesn't exist." Do you know what I mean? Like that isn't a um that isn't a like, you can't go to someone that's qualified, that's understanding to make that decision and say, don't worry about my kid, lifeguard. Like, you don't have to worry about it.
Oh,
You
wait,
know, my
here's
kid's gonna be
a
fine. You
better
know what I
way
mean?
of looking at this. So hold on, here's a question. And I forget the term for this, right? But like, uh, do you believe in like medical like patient medical directives? There's a term for this, again I forget what it is, but like we're like, hey, if I'm ever incapacitated, right, this is what I want, right, including like refusing care, right, like if I'm brain dead or something, well then I don't want to go in a ventilator, or if yeah, my heart stops, right? Like, like do not resuscitate, like DNRs. Um, like, are those valid in
Yes,
your
but that's because
worldview?
you are consenting about your life. The child is not consenting.
No, 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 no. Let's move away from the child because you keep hiding behind this child thing. I talked to you about adults previously,
That's
right? I said,
critical. That
hey,
is a
adults
critical
can.
distinction. I'm not hiding behind anything. That's a
No,
critical
hold on. But
distinction.
I specifically had the example of me as an adult presenting to a doctor, presenting to an emergency room, and you said before, hey, once you go into the hospital and you say you need help, well, then now it's up to the medical professionals and they get to decide. And I was talking specifically about adults. I made it very clear. I was talking about adults, right? You agreed to that. That we're talking about adults. Hey, when you go to the there and present there, then like they get to make those decisions. I said specifically, they don't get to override my agency. I still have agency. You said no. Okay.
Well,
The a DNR is an act of agency, right? An act of patient agency. I'm going to write down these instructions, right? Even if I'm sedated or otherwise incapacitated, these instructions take precedent. Why is that different from me simply vocalizing to a doctor that I don't want this medical treatment?
why is there? I mean, the medical treatment is presumably in the face of something that's happening. That's happening to you, and a DNR is something that could possibly happen in the future.
But it's happening now. They get activated when it's triggered, right?
I
They
mean,
look over
DNRs are given are taken when like you already have like a terminal diagnoses, something like that. You're not going to just have a young person with a DNR. I honestly don't even
hold on, yeah,
know.
you can.
Is that true? I don't
I
actually know.
don't think
Yes,
that
you
they would.
can.
I do
You can
not
have
think.
medical directives for anything.
No way. I genuinely do not think that they would think that you're out of your mind and that you're probably a 5150. I think.
I had a young person within my family who had a DNR, who had they weren't terminal. They weren't terminal. They weren't expected to die, right? But they did have a severe medical illness. And then when they were incapacitated, right? They it was activated, and they're gone. They weren't even. They were in their mid-20s.
Okay, well, if they had a diagnosis that they didn't, if they if they wanted to end their life that way, then that is their thing. But
There's
that's
they have advice, right, to say that you should actually like come up with these medical directives now, even before you're diagnosed with anything, right? Hey, like talk to your family, and decide like what for a medical plan, because you never know when this could happen, right? Like I could get hit by a bus, right? And then what does my family know? I've never sat down and talked to my family about what my wishes are, right? What my wishes are if I'm put on a ventilator? What my wishes are if I'm brain dead, right? That'd be up to them because we haven't discussed it. You've heard this advice yourself, Dr. Greg,
yeah,
right?
yeah, of
You've heard
course.
the advice that like, hey, have these conversations and have it written down. So yeah, even if you are perfectly healthy, it's recommended to have these directives.
Yeah, I mean something that happens to you, but I'm saying like me, like right now, if I'm healthy and nothing's going on with me, I just walk into a hospital and with a DNR for some reason, like they wouldn't listen to you.
No, 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 they would. They have to. No, by
No, I
law. It's
don't
not
think
up
that
to
they
them.
See,
Right?
would.
That's the whole point.
I
That's
don't
my
my
think that they
intuition
point.
is
would.
correct.
Yes.
If nothing was wrong with you, and nothing was wrong with you and perfectly healthy, and you just had a
It
DNR.
only activates when something happens. So like you can walk into a hospital for something that's presenting as minor, right? But still bothering. You show up in a hospital, but then it quickly escalates, like in a way that the doctor didn't see coming, you certainly didn't see coming, right? And then quickly escalates. That happens.
Yeah, in extremely yes, if you get in an accident or something and you're a vegetable and all these other
Not just
precluding
that.
but if you I'm sorry, but if you can't just walk around with a DNR and be healthy and young.
I'm sorry. I'm sure we can just look this up, right? Because I'm sure you're
we should
wrong.
probably. My intuition like strongly leans towards that you as a healthy person can have a DNR, but that I'm just going by intuition, largely intuition. Although I do I have also some people in chat saying that they're fact checking. Like actually, it appears to be
Legally, so short answer, legally yes. In principle, practically, almost certainly not. The system is built to override you. So legal lawyer, practical lawyer. A DNR is a physician's order, not your declaration. You cannot self-execute one. A DNR implies that the responsible physician has in advance decided that CPR will not be performed. You need the physician to sign. A physician who believes CPR would restore a healthy 40-year-old to full life will typically refuse to sign and generally within their right to decline. A post is closed to post forms. I don't know what posts
you can get one, but you need a physician to sign off on it. But even then, it can potentially be overridden.
Post is close to you. Post forms are the forms EMS is legally required to comply with in the field, but the eligibility gate is explicit. Only seriously ill people with limited life expectancy should have a post, and a post is not for healthy people. It is specifically intended for those who are terminally ill or medically frail. The instrument with the most enforcement power is definitionally unavailable to a healthy person.
It's definitionally unavailable to a healthy person, but like you can suddenly become unhealthy. Like that's, I mean, that's how insurance works, because we understand that you can suddenly become unhealthy. If we all knew into the future, right, our medical status, right, what's going to be along the lines, and insurance breaks down. Insurance works because none of us know, right? There's a bunch of healthy people watching right now, right? A few of us are going to be extremely unhealthy. And it maybe in a few years, maybe a few decades, maybe tomorrow, you're going to get all of a sudden extremely unhealthy. And so if you, you're correct. It can be overridden. That part, you're absolutely correct. It can be overridden. But like the point is, like, when you are incapacitated, so like if you have the I believe Advanced Directives is the name. If you have the Advanced Directives, then you have it's an act of agency. And the point is, right?
And you're outsourcing your agency.
Yeah. So why I still don't understand this. Why do you think that, like, so what about what they do in Canada?
Like Prime, like why
medical
assistance in dying?
Yeah, medical assistance in dying. Yeah. So like, should you be able to well, yeah. First of all, yeah. Do you believe in a medical assistance in dying?
Yes, yeah, that's fine. But again, dude, this is we're talking about adults that are making decisions that like these are children that can't make decisions for themselves. It's again, I think it's different. We're talking about criminal negligence for a parent to a child. It's different. It's different, man.
Well, I understand how you perceive it as different, but like the parent is the decision. Like the parent is essentially the voice of the child.
But yes, but and they are not consenting, and the patient, but the child is not consenting to this.
Consent.
They can't exactly.
I mean, technically, you're essentially saying the child can't consent to anything.
Exactly. Then, yes, as a parent, as a parent, you can override them in order to do a lot of different things. Exactly, and that's why you can be charged with criminal neglect when you fail to give them and shield them from harms.
parents have no parental rights on their children, though, and like, at least that's sort of like what I'm leaning towards. At least that's how I'm interpreting your words. Like,
What do you mean?
because like if you're saying so I'm saying that like the parent is essentially like the voice of the child,
Mhm.
and from what I understood of your response is like, well, the child can't consent, and therefore you're like, what I'm interpreting that is like pretty much like the parent can't do anything to intervene, like at all, no matter what. Like they have no like as soon as a parent walks into a hospital with their child, they have to have absolute faith uh, in the medical system, and they can't, like, they forfeit all parental rights.
To make overriding medical decisions where they're going to be able to micromanage, absolutely, yes. You don't have the right to
Sure.
go through like a brain surgeon, and while they're operating on your child and being like, hey, actually I think you should make this cut instead of this cut, I want this happen instead of this happen.
Sure.
You don't get to do that as a parent. No.
So what if, okay, both individuals both individuals in a situation have medical training. So in this case, the parents have medical training and the doctor has medical training. But the parents are going to go there because obviously the doctor's there. They're equipped, and maybe it's something they can't do themselves at home, so they go to a hospital. Now, according to you, they've lost all agency at that point, right? They've taken their child in, but they know, right, what medical treatment should happen, right? The doctor has a different opinion, and the doctor, the attending doctor, is incorrect. At that point, it's too late, correct? Right? Like the doctor is going to follow that plan. Now, maybe they can lose their license later on,
Yeah.
but the parents, the parental doctors, they can't do anything about that at that point, right?
Yeah.
Like they're locked in. The moment they walked in and presented their child, then they're locked in, correct?
Yeah. I mean, pretty much. I mean, if like towards the
Ridiculous.
cynicism, it is. That's just what it is, dude.
That's not what it is.
That is what it is.
It's in your head,
Yes,
Dr. Gray.
yes.
It's not what it is.
That's
what you want to happen. That's
like,
not what it is, though.
like, dude, bro,
right? We know that's not what it is.
there was
Not what it is.
there were medical treatments that were given like that weren't given to my mom for cancer, and I'm doing research and I'm doing scholarly research. I know that they're available for her exact mutations, for her ability, like, and I'm like, we need to get these, we need to go to do this, this is what we need to do. And it didn't happen. You know what I mean? Sometimes just because you are like more well-informed than the oncologist or something about this particular thing, they're following their best practices. Do I get to like charge him with neglect? Not necessarily, because he was following the best practices that he knew at the time.
I didn't say that. Hold on. Sorry. We don't have to introduce that. I'm saying, like the thing that we're focusing now is just on agency. We just haven't gotten a past agency. We haven't gotten to criminal consequences, right? So, like, two people who are equally credentialed, right? Because these credentials, these licenses, apparently override other people's will. Okay, right? So they both have these things, but one of them is actually it's activated in this case because they're the attending physician, they're the doctor, and the other ones, right? They're maybe from another hospital or whatever, right? And they can't simply use their licensure in this place. They've now submitted themselves to the care of this facility. And then in your mind, hey, the moment they do that, right? Even if they know better, they can't say, hey, like, don't do this treatment to my child. Don't do an active treatment. There's one thing to, even with a whole treatment, right? There could be plenty of reasons why you withhold treatment. But they're watching as the doctor is putting the pill in the kid's mouth that will do active harm. They know they will do active harm. You're saying, no, they can't refuse that. Like, I know it's going to happen. Me with my doctor knowledge, right? I know it's going to happen. The kid's going to have a bad reaction to this. I know it, right? But the doctor is not listening to me, and he's going to do it anyway. And you're saying at that point, it's too late. You walked in, you picked the wrong hospital. You
Yeah.
walked in, and now
Yeah.
they have all the power.
You have to leave. You have to leave.
Wait a minute.
Well, okay.
How can I? No, no.
You have to
You
leave.
said before.
You have to
You said
leave. You have
before,
to
first
sign
of
the
all, right, that
consent
they
to say I'm going
bend
against
which way.
medical things, and I'm leaving.
Oh,
Yeah.
hold on. Now we have agency. Now we can leave now. We can refuse care. That would be refusing care. We can
Yes, you
refuse care
can.
now.
Yes. It's
No,
informed
before
consent.
you,
And
this entire time you've been saying otherwise. This entire time you've been saying otherwise.
No, I haven't.
That's what this entire argument is about. You've been saying you can't refuse care.
You can't. There is a path there. It's a river, a lazy river of science of how it is. If you either go on it or you don't. Like that's what it is.
This is why I gave the example of both being doctors, right?
Yeah.
Because yes, as we agreed previously in the past, scientists aren't infallible, right? They make mistakes.
True.
The learned people make mistakes all the time.
Yes.
That's okay, right? Especially if they're trying their best. In this case, the attending doctor is making a mistake. They know it. And you're saying, and before you were saying that it was too late, right? Like, there's only one path forward, whatever they decide.
Yeah,
even
when
if
you're
they are
when
going
you're
against
out
the
and you're
science.
unconscious and you have you're signed the
Stop
forms, and
introducing
that's
new
yes,
things like
yes.
unconscious. I gave you a perfectly good working scenario, right? When the two parties
Those
have
are the
equal knowledge,
differences.
but one make a bad decision.
Those were the scenarios where yes, you don't get to micromanage what the best care is, but and in this scenario when you have two like medical doctors that have similar things and they're doing harm to your patient, like I mean, which is like pretty like I mean a little farcical, but it's okay, you know. Yeah, I mean, you would say,
It's not
okay,
farcical. People
I'm
have medical
leaving.
injuries
I'm
happen
leaving
all the time.
the against medical advice, and I'm leaving.
Okay, all right. Okay, apparently now we have an agency. Okay, I mean, if like if that's the case, then the mother, she will leave the hospital with refusing the vitamin K shot, right? And say I'm refusing medical care, which is what they did.
The parents, well, no, they stayed, and then they got the blood transfusions, and then they got emergency vitamin K shots and all that kind of stuff.
I mean, when just after giving birth.
The article we were talking about, the one they got a blood transfusion and an emergency vitamin K shot. They didn't leave.
No.
Yeah, but I believe this was after like birth, and like I think they were taken home at some point, and then they had to return due to the medical emergency.
Yeah, two incidences. One after giving birth. That's when the vitamin K is originally supposed to be administered, right?
Yeah.
They refuse, and then later on they come in with the bleeding, right? So there's two instances here, and the first one is the thing that we're discussing. So like in that case, right? As what happened, right? These parents, they come in after they give birth, right?
Mm-hmm.
And after the birth, they say no. They refuse. Now you're saying they can refuse. They have the ability to refuse. They should be able to walk out and refuse care. That's what they're doing. Correct?
Theoretically, they could, but yeah, I think that if you
Not
get
theoretically, actually,
but you should absolutely get charged if the bad thing does happen, that we know what's happening. I mean, your scenario here is this pill that we know is doing harm versus a shot that doesn't do harm, and all it does is protect people. So that
the doctor thinks it's not going to do harm. The doctor believes it's going to help the kid. But the parents who have medical training know they will do the opposite.
But that's not what's happening with this shot. Like that,
I didn't say it was. That's what the hypothetical is.
I know,
but
I know, but hypothetically.
Okay. I think we've reached the. We can move past. But you go first.
I'm just curious. Well, a couple of things. Like, based off of how I'm understanding what you are saying, it's like, more or less like, if you're going into the hospital, or let's say if you're a parent with a child going to the hospital, you are like more or less like placing a lot of faith, or like, you're more or less like, I think more as you frame it, of like doctors have this special license and they more or less act as God in those facilities. Do you not think that can lead to emboldening some bad actors? if that mentality is
Yeah, it happens all
actually.
the time. Yes. And that's why we need
But
strict
don't you?
overhead. That's
But
why
don't,
we need strict, like, we need to
But
be
it's
going
already too late
after the
when you
ones that
walk in,
are
though.
using their
but
license with incredulity.
but you're emboldening them though. But you're
No,
arguably
that's
saying
just the
like you.
fact of the matter, dude. It's just the fact once you're in the
No,
hospital
no, no.
and once you're there, the medical
I'm.
professionals know more than you, and you should be like, giving
I
up
don't
some of
disagree.
your stuff to them. Yeah.
I'm generally on the side of medical professionals, especially as someone who has received a lot of medical care. But I'm curious, like, uh, let's say, for example, a parent brings their child. Okay, I don't know. Let's say they're 10 years old. Okay, and turns out this child has appendicitis, and like based off of the doctor's analysis, they say, well, this appendix needs to be removed. But then the parent says, I don't want. There's let's say the small chance of the appendicitis resolving on its own. Does the parent have the right to refuse that surgery for their child?
I mean, like it honestly matters, like the percentage, I would say. I don't know. Like, I don't know if it's a 50-50, like,
But I
or
don't think a doctor would be able to
95%
really
chance
like
that the
really
child's gonna
good.
die, then I would say that you're pretty much, you should it would be criminal neglect to say no. And that's what I was talking about. What's the percentage? If it's 100%, then we can all agree that it's criminal
I don't know
neglect.
that a
But
doctor
what
can
is
give
it? What's
100.
the line? 50%,
I
20%, 10%? It's not 2%. So like, what is it? I don't know.
I I agree, but I don't know for sure. But I imagine like a doctor saying, because I'm in my experience, like doctors don't really want to give like concrete numbers that's like super confident. But like in that scenario, I think they would say like based off of like my clinical judgment, I think your child needs to have this appendix removed. And I can understand a parent. I'm not saying this is a good decision, going against the clinical judgment of the doctor, but I can imagine if like the parent knows like, well, there's a possibility of this resolving on its own. Like, I think that's a potentially equally valid. And here we don't have I don't think we can really truly calculate the percentage in that scenario. But someone feel free. I'm not a medical professional.
No, we know they can't, right? Like, here's an example. Sorry, I'm interrupting you, Corey, but
That's
I'll
right.
pass the mic right back to you. Like, this comes into effect when we're talking about abortion regulation or abortion bans, really, right? Where they'll write into a law, well, like there has to be like an 80% chance or something, like of the patient dying, right, before you like a woman dying before you can like intervene. Well, like how do you know that? The doctors don't know that. There's like no solid number that you can pull out, right, to say that, oh, this person will certainly die if I don't do a medical intervention, right? As we saw when those abortion bans were first rolling out, right? The stories have died down now, but like they're still happening. Like doctors were just like refusing care. Like, I can see this person is in rough shape, but if I make the call, like do an abortion here, to protect the life of the mother, right? That's how the conservatives like to frame this thing, right? If I try to protect the life of the mother, but a jury later on says that, oh, it wasn't certain, right? Like another medical professional comes in on the side of the prosecutor and says, oh, no, they could have survived, right? This was unnecessary. Well, then I lose my license. Then I not just lose my license, I can go to jail, right? I can be fined because this number is imaginary, right? This whole protect the life of the mother, that clause is BS. It's just another way of ban because these percentages aren't a real thing. But now you're saying, well, yeah, I mean, if the percentage is 50 plus one, then maybe they should be forced to have the surgery, right? Depends on what the numbers are. But the numbers aren't clear like that. There aren't. There's no like number. There's not like a number tattooed on their forehead that tells you this person's going to die. What the chances are? There's nothing.
I mean, we have stuff like that for like vaccines for rabies. I mean, you're certain to die if you don't get the rabies vaccine. And if you had
I
a
agree.
child that was bitten by a rabid dog, and you told that child and you told that medical professional, no, I'm anti-vax, and our kid is not going to have any type of vaccine, and the medical professional's like, your child will 100% die if you don't get this vaccine, you would absolutely get charged with criminal neglect by refusing that vaccine. 100%.
I like, to me that is more black and white, because like pretty much having true rabies is essentially a death sentence. I think there's only like 1 or 2 reported cases like in history of anybody really surviving rabies.
No, hold on. There's a difference here. There's a difference in what we're talking
I agree.
about. Yeah, because when we there's 2 percentages here. There's one based on past cases, right? And the accumulation of past cases, right? There's some medical report that says like people have gone through this population that has gone through these medical circumstances. They have 32% survival rate, right? But that does not necessarily translate to this individual case. The person who's presenting in front of you right now. Hey, what is the percentage? People they'll ask the doctor, what's the chances this person's going to die, right? Well, this person has unique medical history, right? Unique interactions. And what's that number? I mean, they can try, they can guess, but again, it's BS, right? Like these numbers, when the doctors have consequences, when there'll be consequences if they quote unquote uh, uh, give a bad number, right? So like I in the example I gave you, when they can suffer criminal consequences, right? If a patient isn't certain to die, right? If wasn't medically necessary to protect the life of the mother, well, then all of a sudden they're extremely cautious, right? Doctors who would have said otherwise, oh yeah, of course this is necessary. All of a sudden they don't want to do it because there's no way to actually prove like this person was 100% going to die, right? There was a small chance, however small, that they might have been able to recover from this procedure, and so like the baby didn't have to be aborted.
Yeah, I mean that's why a lot of these cases in a lot of these Republican states are people are waiting till the mom crashes. The mom is in septic shock. Like they're literally
Yeah,
blood pressures plummeting. Everything's gonna like she's actively dying until they
there's no
they
status
go
meter
in.
on them
It's
that says
awful.
the percent of chance they're going to die or not,
Dude,
survive
stop the
or
stupidity. Thank
recover.
you, brother. Thank you
Like
so
there's no
much, man.
status meter there to cleanly tell you these things, right? And so you have no solid proof when presented to a jury, right? That says, well, we had no choice whatsoever, but to do the abortion.
Yeah,
But
I
in
mean,
any case, I mean, we're moving away from like the main topics. And Corey, I did interrupt you previously.
No, it's
If you
okay.
want, yeah,
No, I think like, so I understand. I think I understand what you're saying. Like for me, like, and again, I think these are like tragic, harrowing stories that, again, going back to my original point of like, I'm the one that brought up like, I'm not. It doesn't feel so great when the doctor says to the parent, "That's not your fault." Like, I think it kind of is. I think there's a strong case to be made that it is the parent's fault. But I understand the doctor being compassionate. But like at the end of the day, uh, and I would not want it. I would not want this to be the case. But like, I don't actually know the numbers, but it is probably the case that the the children, or rather, the children that have parents that are refusing the vitamin K shot for their children, like probably the majority end up like largely okay, but like we have really bad collateral damage, and that's where it's like the balance is not. It's not a rabies situation. Is basically
mhm.
my ultimate point.
Yeah. I mean, I don't know what that percentage is. I don't know where, Russian roulette is technically not dangerous the majority of the time, but it's still not
I know.
not it's not you would still be charged by handing that revolver to that kid. You know what I
But
mean? And
like,
if that
I
revolver
agree with
was
you. Like,
if there was 60 open chambers and one bullet, that would still be that's still not
I
okay.
agree.
Yeah.
I
But that's where
agree.
it's like, well, we're coming like, I know that you know what vitamin K is. I know what vitamin K is. Prime Pie has a really good idea of what vitamin K is, and that the vitamin K shot is essentially harmless, if not largely beneficial, clearly, and saves lives. And so it's like, the cost benefit analysis, as in like in terms of the cost benefit analysis, like it's pretty much all benefit. And I don't know, maybe the only cost is like, maybe the mild pain that induces for injection, and maybe, I don't know, some mild injection site irritation. And maybe, I don't know, that's about, unless a newborn has vitamin K allergy or some, obscure condition that I don't know about. But like,
I know that vitamin K comes after vitamin J. So
F1 in chat said the clinical mortality risk scores, which is acute medical care, exist in in constant use. Interesting. I didn't know that. We actually have one of the people that is, I mean, you probably heard her story of her daughter. They went in Texas to 3 times to the ER, were denied 2 times. The 3rd time went in. They had waited until she was in septic shock to try to actually treat her daughter, and they weren't able to resuscitate her, and her child died completely preventably because of that. So it's yeah, thank you
I'm
for
very sorry
sharing,
for your
Lauren.
loss.
It's awful. And she said
yeah,
she spoke with an attorney from the Center for Reproductive Rights today, and they want to speak with me. They want me to speak to the media about the ectopic. Same doc, same hospital that failed to treat. Oh man, I'm 99% sure I will, but I have severe anxiety about speaking to people. Yeah, Lauren, I can understand. I can totally understand.
Yeah.
Yeah.
I'm,
Yeah, she was your
it-
stepdaughter, but yeah, absolutely, no, Lauren. It's that's totally fine. It's still your daughter, and totally understand.
yeah.
Yeah, it's awful stories, but this is, I think, like, the bigger point is that in the next story that we have, like, I think that people are being pushed this onto them. Like we talked about this before, that these decisions are being pushed onto people, and they are not able to make decisions in their right mind because they are like they are not capable of making these decisions. And when they do make decisions that are for the best of their child, right, they do get the vaccines, they do get the vitamin K. You have an entire, like, media algorithm pushing to say that they did the wrong thing, that it was actually poison, that it's actually toxins. And here's the story from the New York Times. Plaintiff for anti-vaccine group's suit is charged with murder of her twins. A lawsuit filed by the Children's Health Defense, an organization founded by RFK Jr., claims that vaccines caused the twins' deaths, but a grand jury in Idaho has indicted her on charges of suffocating them. On May 1st, 2025, a young mother in a small Idaho town said she found her 18-month-old twins dead in their bed, cold and lying on their bellies. 3 days later, she sat for an interview at the Children's Health Defense, the anti-vaccines nonprofit co-founded by RFK Jr., claiming that vaccines caused their deaths. The story was sensationalized, billed on the group's website as breaking news of toddlers who were born and died together following vaccinations. The organization quickly embraced the woman, Andrea Renee Shaw, naming her the lead plaintiff in 2 legal actions against the nation's top society of pediatricians, claiming the organization, the American Academy of Pediatrics, lied about the safety of childhood vaccines. Then, last week, after a nearly 14-month investigation by the Payette Police Department, a grand jury indicted Ms. Shaw, 23, on charges of murder, claiming that she suffocated the children in an act that was either premeditated or taken in the course of aggravated battery. The police and the county prosecutors did not release details about the evidence or return calls from the New York Times. Quote, "This arrest is the result of a lengthy and thorough investigation conducted by the Payette Police Department with invaluable assistance from numerous parties," they said.
Yeah, this, at least from what I extracted from the article, it seems like just like the Children's Health Fund is latching on to something they can weaponize. And that, obviously, it seems like there's an investigation. Like, do we know for sure that this individual, let's say, suffocated, or like they were the ones that essentially killed their children? I guess, no, but let's say there's a strong case to be made that it's not the vaccines.
Yeah, it's definitely not. I think that what happens is that you have extreme guilt given to these parents, and they feel like they are being, that they did something so malicious to their kids that they have to like in a sick way in their brains, like fix the problem that they caused. And I think that's what's causing this.
Yeah, no, absolutely. I'm just curious. Well, yeah, obviously I want to see how this investigation plays out. But like, even if it, yeah, I don't think there's any vaccine, as far as I know, that can cause not just one but two deaths in that nature.
Yeah, there's no way. There's no way. I mean, that
It would have to
doesn't
be like the
doesn't
most
work here.
obscure,
But
rare case.
but in their mind, that is what happens, right? They're I'm sure they're thinking it's SIDS related or something like that, and they could that how they put the bodies or something. That's probably what she's thinking, that it'll just be this.
Yeah, or I don't know. It seems like from what I remember of the article, it's like the Children's Health Defense reached out to these parents when they learned of this situation. At least that's the sentiment that I got. It seems like the no surprise, the Children's Health Defense is just looking for anything that they can weaponize, basically. And this seems to be like maybe not the perfect case, but a situation where they can do that.
Yeah.
And like, it would not surprise me if they, and I think I got this sentiment from the article of like, they planted the seed in the mother's brain that it was the vaccines.
Yeah, I mean, this has been something that I've really, people get frustrated when I talk about this. I'm not diagnosing this with anyone, but what it feels like is these algorithms and these anti-vax conspiracies push people into a state that's very similar to like a paranoid schizophrenia, where they basically they're unable to distinguish reality from like these conspiracies, and they get into these the manic states that are causing them to do like that, basically incapable of making decisions based off of analyses and data, and it's just it's so dangerous. These algorithms are pushing people into these states where they're doing things that are literally out of their mind. What are the symptoms of schizophrenia? Delusions, hallucinations, disorganized speech, unusual behavior. I feel like it's something that, like, in conspiracy people, that you see a lot of this. Like everything becomes the conspiracy, right? Everything is like it's ever encroaching, ever encompassing, and it's just and it creates this level of you know these parents in a scenario where they shouldn't have to know what vitamin K is. They shouldn't. They shouldn't have to know what adjuvants are. Like, we have this, it's settled science. We made such a big progress that they don't have to know about it. In the same way that you don't need to know what a CPU is and a GPU is in order to own a computer. You just type on the keys, man. But at the same, but what they're doing is they're going in and they're pulling out things on the motherboard, trying to make it go faster. It's like the Homer Simpson speed holes. Like, they're just taking a pickaxe to the computer because they're trying to make it faster. It's so sad.
Yeah, no, I agree. There's that. It appears to me that, like, yes, algorithms are. I don't know if they're creating the situation or just making it worse. But like, but it is interesting. Like, clearly, it's not happening to everybody. It seems like and I don't know what the prerequisite personality profile that you need to have in order, like, to be caught up in these, not only just caught up in these algorithms, but these specific sort of like, anti-vax algorithms are like, can I foresee the right circumstances where I get sucked in? I would like to think no, but I can imagine a Clockwork Orange scenario, someone just prying open my eyes and just subjecting me to reel after reel or TikTok after TikTok, and I eventually come out with anti-vax beliefs.
Yeah.
But is that what's happening with these people? I don't know. Like, yeah, I'm curious. Maybe I should look. I don't know if there's actual data, but like, let's say your typical. If we know of an anti-vax person who is claiming that they have the knowledge of like I became anti-vax due to all of the stuff that I see on social media, then I'm just curious of like how much time are they spending on social media? Is it really just like are these type of people that are spending like 8 hours, 10 hours, 12 hours of their day, just reel after reel?
Yeah. And
That's
I think that is something that we have to do as a society. We have to be able to come back. Oh, thank you, 5 minute. Appreciate you being here. I think that we have to have like some type of posthumous, like you lose your right to know what, like we should be able to see your last 1,000 stories on TikTok and Instagram and Facebook. Like if you do some like some act or something, like go do something at a school, or you know what I mean? Like we should have some way of knowing, like just for like quality checking, like what were you being fed? Like what were the last 1,000 stories that you were seeing? And then, we see a bunch of stories about this stuff, like like the guy that shot up the CDC, like 200 rounds killed
sure.
someone,
Yeah.
like what was he like, what was his media? And if that's 1,000 stories of how evil the CDC was, and they're such bad people, like Facebook or
And now
whatever.
Fauci is the devil.
Yeah, exactly. The TikTok should have to answer for that and be like, yeah, okay, maybe we won't do that. Maybe we won't. Maybe we'll chill a little bit and on it next time. Like I think that there
Uh,
could be some type of accountability.
I agree. That would be useful information. Like, but yeah, do we? Is there a way? Is there a world that we can have access to that data? Or let's say, I imagine government would have to intervene into these companies, saying, "Hey, you have to share this
Hey,
data
Bobby.
with us in this circumstance."
Yeah,
If
I mean,
someone has, let's say, been flagged or whatnot,
I guess you
or
do.
let's say, or if you can do whatever. A retrospective, like we know this person who shot up the CDC. Can we get the data if they had a social media account? Like, what were they being fed? And
Yeah.
then like, well, yeah, does that introduce privacy issues? I don't know.
I mean, but
At least that's where
privacy
my mind.
issues, it's such a weird argument because like that data is already being sold to other corporations. Like Google is buying
Sure,
that
I agree.
information and what you like and how you like to watch your feed and all that kind of stuff. Like Google gets access to that. All these other companies buy that information off of you. But in order to prevent the most grievous things that exist in the world, we can't have access to that as a government, just as like a quality QC.
Or as a people, like I think probably, and although I'm pretty sure, or I'm reasonably sure, public sentiment towards social media apps and companies is not so great. But I actually don't actually know for sure. But
Mhm.
I'm leaning towards they don't view them all. But I think public sentiment would skew even more negatively if people were able to see, or if through access to this data of like, oh, this CDC shooter, we now know that these were all the reels that they were being fed leading up to that, and it was all pretty much as you characterize, anti-CDC and Fauci's the devil. These are all criminals. I think public sentiment would shift even more towards negative.
Yeah.
And if they're able to, if in fact it's true, if it holds true that, oh, we can see a direct connection or a more direct connection between what is being fed to them on social media and their behavior, their potential criminal behavior in the real world.
Yeah.
And then I think then people will be able to see the connection. But then it's like, yeah, is that, do we want to live in a world of like the government can just go in at any time and just say, hey, give us the data from this person? I don't know.
They already do though. They already keep the NSA like catalogs the
Oh,
entire internet.
if they do,
It's all searchable.
but then then arguably, like, I don't know, then things like the CDC shooter should be preventable, unless there actually is no link. Then, right?
Yeah, I mean, presumably there should be, like there are safeguards, but yeah, I mean it's just not. It's too many systems, too many links that aren't cohesive. I guess that I think that's the big problem. But anyway, Prime, what do you think?
I don't know. I don't know if it matters what the public's opinion on these things are. Like we already see when like hate crimes happen, right? Like we can trace the online steps of these like shooters or whatever, and we know they go down a lot of like right wing pipelines. That doesn't really change anything though, right?
Mm-hmm.
Like, does it? Like, I don't know, like what that ever gets us.
Well, I agree with your characterization, but if we had the exact actual catalog of reels that was being shown and people can access it and see like, oh, here's the last 1,000 reels in the last whatever X amount of hours, that I
mean, we can see their. I don't know. We can also see the. Yes, I've never seen a situation where we get like the exact like catalog of videos they went through, but we know the creators that they listen to, right? Like sometimes they're even kind enough to write a manifesto saying,
Yeah.
"Oh, it's these guys I listen to," right? Yeah.
Huge Benjamin Vero fan.
But I don't know that unless unless the general public is familiar with these creators. I don't know that it will. I'm speculating again. I don't actually know for sure.
Will the general public take the time? If they're not familiar with the creators, will they take the time to look at like the exact videos that they went down?
If it's like maybe 10 reels, I think potentially, because I mean, well, reels are popular for a reason.
I mean,
so with the assumption that it only took 10 reels to radicalize a person, I mean, maybe, but like,
well, no, I'm giving like a small example.
Yeah.
But like, yeah, but it's again, I think if I suspect it will crystallize it more for people. I could be wrong. Obviously, I'm speculating, but I think if they're able to like,
I mean, I'm not trying to like bust your balls on this or anything like that. I'm just like, I just don't see like, I just don't, I don't. We live in a society where we have a lot of dangerous individuals who aren't receiving like proper um, psychological care, and they're walking around. They got like a whole bunch of influences, right? For most of these people, we'll never know what those influences are, and they'll do a thing, unfortunately, and people will get hurt. For some of them, especially in this new digital world, right? We will know, especially since we have now like it's a paradigm, right, among like mass shooters to write a manifesto, right? That's part of the game. Write a manifesto. That's a good way to get remembered. Did you write a manifesto? Was it good? You should get the spell checked, beforehand, because it's going to be on the media, right? So like in this case, we have actually an unprecedented view into the minds of like these like unhinged individuals, which we just simply never had before. Right? This is like a new thing in history, really, right? And yeah, some of them tell the creators, explain which creators they may follow online, but like one way or other, like the public is like aware, like that online radicalization is a thing. That's another thing that's in the cultural zeitgeist, right? Like online radicalization. Now, some people think, well, the right is the one who radicalizes more. Others say the left radicalizes more. But like both sides agree that radicalization happens online. Okay, now that we've established that, what do we actually do about it? Like I don't know if the public, one, is equipped to figure it out, and two, like can hold on to these tragedies long enough to actually make some sort of to make much of a policy change, right? Like especially in a country like the United States where we have these tragedies all the time, right? It's just a countdown until the next major shooting, right? Because we have like shootings every day in America, right? Mass shootings happen every day. It's just like one of a big enough body count to actually make the news, because most of them they're not worth talking about here in the United States. So yeah, and some mass casualty situation, like yeah, it happens. We generally just move on. I mean, we spend actually an incredible amount of like of media time like on like the big ones, right? And there's a lot of focus and there's a lot of wondering why and all that. Like people, the public ask why. but then nothing really happens. So I mean, I don't know. I feel like after all this time, I don't know if like a catalog of videos. Well,
No, that's fair. Your skepticism is justified. What I would say is like, I think it's an experiment worth trying, and if it does nothing, then we can just go back to how it was before.
I mean, yeah, I mean, I don't want to be the bearer of bad news here. Like, I want I want to be able to tackle this. Like, this is not a good thing, right? Like,
Yeah.
I don't want to defend this ask. I want us to take some sort of action. I'm actually not sure what action to take. I won't. I don't have.
Yeah,
a
neither do
policy
I. I'm
for
just
this.
like thinking out loud.
Yeah.
And
Yeah.
like, yeah, all the points that you made are valid criticisms to what I brought up. But then I still want to run the experiment.
Yeah, I mean, like whether or not like this mom that, you know, presumably implicated in killing her kids, like what was she being fed? Like what was she, if she was getting fed 1,000 stories of how vaccines, you know, killed or are going to kill her kids, you know, and she, in her mind, she's thinking, oh my gosh, I could take agency, like I, you know, I can do something about this, I could, you know, help fix this. It's like, then, you know, I think that whatever social media platform should be definitely held responsible for some aspect of it. I think we're all, you know, kind of like in my criminal negligence example, or this, you know, like I'm trying to figure out transparency of the algorithms. I think we're genuinely fighting new threats that we as like a, you know, society or global community, you know, are we're all connected on this stuff, and we need, you know, new and innovative ways in order to solve these problems. I don't think anyone has the answers, but these are honestly the questions and the topics to really like be talking about in order to try to figure this stuff out.
Yeah, I agree wholeheartedly.
The RFK is polluting people's minds, and he's also causing a huge cluster, an outbreak of stomach illness across the United States. Public health experts said that there are more cases than usual of the disease caused by cyclospora, which is spread through contaminated food and drink. It's happening right now, ladies and gentlemen. More than 400 people across 18 states have been infected with cyclospora, a parasite that is transmitted through food and water contaminated with feces and other, which causes stomach cramps, nausea, vomiting, and severe diarrhea. At least 20 people have been hospitalized, according to the CDC. New York, Texas, Illinois, and Michigan have the most cases so far. Sporiasis, the disease caused by the parasite, is most common during the spring and summer months when people are eating a lot of fresh produce like basil, cilantro, spinach, and berries, which have been implicated in the past outbreaks. The illness has sparked alarm since case numbers are unusually high and have no identified source. The CDC, which tracks infectious diseases, reported on July 1st that there has been 145 cases across 17 states, but there's usually only a couple of 50 cases per year, but now there's hundreds basically. And the RFK actually took down the part of the CDC that tracks and looks at parasitic diseases and monitors these things. So yet like another thing that we are caught with our pants down on.
Well, I'm glad I'm in Canada.
Yeah,
But
exactly.
wouldn't surprise me if it made its way up here.
Yeah, exactly. It's just I can't. These people are just so unserious, man. I wish I wish it wasn't so predictable. And then our last two story. Go ahead, Corey.
I just say this jokingly, to be clear. This is all a joke, but my joke is a bad joke. But like, this is nothing to worry about. As in, if you're healthy, you know, you will not get infected by this. Just let your immune system handle it.
Yeah,
fine.
easy peasy, easy peasy. Last stories for basically human health is.
We could save my weather story, like if
Okay.
you wanted.
Okay, yeah,
I think there's a much larger conversation.
Okay, cool.
To be had for next week.
Yeah.
Good point. I like that. Okay, awesome, guys. Well, thank you for coming on. I appreciate you. Thank you for the chats. And yeah, do you guys want to do closing statements?
Yeah, go for it, Prime.
Oh, yeah. Thanks so much for having me. Much appreciated. Stimulating conversation. You can find me at Twitch, Twitch, YouTube, Kick, and technically TikTok at Prime Kai, PRIMECAYES. Love to have you. Do debates. They're a lot of fun. Come through.
And yeah, as always, grateful to be here, and always appreciate the spirited back and forth. But yeah, you can find me on Twitch, CoreyCam84, Twitter, X, YouTube, Instagram, Substack, TikTok. It's Corey Campbell. And yeah, looking forward to next week.
Awesome. Thanks, guys. I appreciate you as always. Have a good one.
Always a pleasure.
Mhm.
Take care. Be well.
Bye. All right, guys, how's it going? We are, here we go. We're back. Sorry, I had to do this thing. We're back here. What's up, guys? I finally got everything going. Dude, marquee just changed. Boom. saferi.org, guys. This science panel, I need to start doing this. I need to start doing this. Okay, 1 second. 1 second. Nope. 1 second. Guys, it's gonna be good. 1 second. Oh, dang. Never mind. Never mind. Never mind. I was gonna say, this week's science panel brought to you by Safe Research Institute. Guys, science and freedom for everyone. The foundation is going. We're submitting the 501c3 application this week. And if you are interested in helping educate the public and legislators on what science-based legislation looks like, head to saferi.org. That's Safe Research Institute.org. Saferi.org. Check it out. We are fighting for science legislation to be passed at every single state house through the 501c4 and through the 501c3. We are trying to educate and create model templates that legislators can learn and build off of in order to pass at their local levels, so at their cities and at their states, in order to help with vaccine access and raw milk scourges and fluoride, keeping fluoride in water. Yeah. How was your modeling job and science interview? Thank you, Michelle. Oh, you're so nice. It went really well. Honestly, it was a crazy good day. Honestly, like, this is a wildly good day. Like, really. Started off, I had my agency. So I reached out to 30 different acting and modeling agencies over the last week, and this one got back to me within 12 hours at requesting an interview. And they've been around since 1999. And they're legit. And he came in there and he was just like, yeah, you're really unique. We don't have anyone in our roster that's like that's like you. I checked them out for just doing due diligence. Are they active, or do they actually like seat people? And it's true. They have the credentials. They're putting people in TV and movies and stuff like that. So these seems legit. And yeah, so I'm waiting just like a little bit of time just to see if anyone else like contacts me and stuff, but I'll probably sign with them next week. They don't have an exclusivity contract. They basically, which is cool, because I asked him about that. I was like, I can leave at any time. I don't have like an exclusivity contract. He's like, no, dude, we're going to be you know, you're going to want to be with us because we're just getting you tons of work. So we don't need to have like an exclusivity contract. That's for weak stuff, you know? Um, did I ever think that I would be modeling? Honestly, no, user. This is like my OnlyFans moment, you know, where I am like, um, I'm a little embarrassed by it, to be honest with you. But it is what it is. Am I going full time? I mean, so Helen, what it is nowadays with phones and cameras, and honestly, the setup that I have now, like with my professional mic and my soft boxes and all that kind of stuff, what I bought was a gray screen for the back here, so I could just put the gray screen up and I could do auditions here, and um, I could just do the first round of auditions here, and then that allows me to not have to drive to Hollywood and stuff all the time. And that's awesome. So that's how a lot of them are done now. Commercials and movies, and so it's just kind of, yeah. What kind of modeling is it? So I've done some modeling for um drink companies, a drink company, and then I've done some acting work um for basically like beard clubs and stuff like that. So I've done 3 acting jobs and I've done 1 modeling job. And it's honestly so weird because I am like trying my best to get back into the lab as much as I can. I've sent 250 job applications for, you know, trying to get into the lab, and I just haven't gotten, you know, any. I've gotten honestly a lot of really good looks. I've done a lot of good interviews. I've had some really good chances, but I just haven't been able to kind of like land it. And so I just need to get lucky. I just need to get going. How about some eyeglass wear? I'm not bad. I'm not opposed. I was actually, I don't know why I stopped wearing my eyeglasses. I don't know why. Because safe is going to be your full-time science job. I mean, that's the thing. Honestly, Michelle, it's so funny. Like, boom. I don't like the glare. I don't like the glare of my glasses. It kills it for me. It really frustrates me. I'm very picky about the show and the production value of it. Um, so yeah, it's weird to have like nonstop action, like, so like the modeling and acting side, they're like emailing, they're trying to get interviews with me, they're trying to push like into it. They are polarizing. They are polarized. Yeah, they are. Um and I just got a lot of lights going on. Um so it feels weird, man. It feels really weird. It feels very frustrating because it's like the science just doesn't want me, and I'm trying everything that I can just for men. I mean, Lauren, I did a beard club, so I basically did the just for men kind of stuff. Yeah. Oh, on the camera lens. Oh, that's interesting. Yeah. So, oh, Michelle, thank you. I'm telling you that science lets you go because you have bigger and better things. I mean, all my science friends are going like, "Why are you trying to get into the lab again? What are you doing?" Um, so basically, okay, so that was this morning. So basically, it was like a 20-minute conversation. The guy was like awesome, totally wants to work with me, really wants to do it. He was like, just be as active as you possibly can be, you know, like just push onto this, like treat it as a career, not as a hobby, you know. And I was like, okay, you know, I want to. He asked me like basically straight up like, do you are you prepared to do these auditions for these roles? And I'm like, I've never done one before. I don't know, but I'm going to learn and I like doing it. So it's kind of like pushing for reproductive rights right now. You're spinning your wheels as long as you can. Yeah, I think so. Lauren, I think especially for that stuff, like, there's so many awful stories coming out of it. I think that it's going to change. The clapbacks is going to be really hard, so, um, so anyway, yeah, it was really interesting. The guy was like, he was really cool. I was asking him about, like, do I need a carve out? Like, cause he has an exclusivity contract for the commercial, acting. And I was like, do I need like an exclusivity contract for my show and that kind of stuff? Just so that it's like separate. And he was like, dude, I don't care about like you, about your YouTube channel, like that doesn't mean anything to me. What I hope is that you like working with us enough that you actually want us to help you with it. And I'm like, oh, dude, dang, that's so true. That's so awesome. So if I got like some help and like with some production value and stuff, I would love that. Like I do, because I do see this. Hey Dave, how's it going? I do feel like, I mean, I do feel like I want to actually do like an actual show. That is my goal. I would love to do like a modern take on Real Time with Bill Maher, you know, something like that, politically incorrect, the round table, debate style. I think that would be so cool. I would love to do that. Um, yeah, Heather. So he was like, I'm not making. Are you going to start acting? I have been, Dave. Yeah, I have been. Um, Yeah. So, I mean, this is so small, that I would love to have like some production help with it. That'd be so cool. So, um, yeah, I would love. I mean, look at Pierce Morgan, right? Pierce Morgan has a successful, daily show, that he does that's amazing. So like, why not have Pierce Morgan basically have like my show be like Pierce Morgan, right? Where it's like a daily show. That's yeah. Um, Anyway, so that went really well. The guy's awesome. I'm really, really happy about it. And probably gonna sign with him. And then yeah, Don Lemon is another great example. Yeah, they're all going online, Helen. Exactly. They're all going online. Oh, thank you, Bobby. Thank you, Michelle. Thank you for the gifts. Um, and they're all going online anyway. So, and I'm already there. So I would want to. Oh, nice, dude. Yeah, I basically I had a meeting, Dave. I had a meeting with a SAG listed, a SAG approved agency today, and um, yeah, it went really well. Um, and so anyway, so that happened, and then today I also got called back on a science job. Thank you, Lauren. Thank you, Helen. And that went really well. So it's only for a 6-month temporary position, which is kind of frustrating, but whatever, I think that within 6 months um I could definitely demonstrate my worth to them. It's so I was a scientist 3 before, and making $100,000. This is a scientist 1 temporary where I'm actually making 110 to 130. So I'm like, I was getting paid excuse me. I was getting paid so bad at BASF. I was the largest chemical company in the world, and I was only getting 100 for a scientist 3. Like what? That's incredible. So yeah, Leah, I think, I would definitely, show myself to be an indispensable part of the team, after that, for sure. But also, I mean, I can I can just keep looking. I can just keep looking, right? So that's also good. Oh, interesting. Interesting meteor. Yeah, I haven't looked at that. I just have webcams. I don't have like actual DSLR, like full frame cameras. Yeah. Yeah, Dave, it's been wild. It's been wild. Hey, what's up, Just in Time? How's it going? So yeah, it went really well. It went really well today. Oh yeah, and then also on top of that, the jujitsu gym that is being spun out from my professor. So my professor at the 6 a.m. Class that I was going to, for so long, and I really just like bonded with this guy. He is so cool. He's such a good guy. He's he's done jujitsu his entire life, and he but he went to get an undergrad degree, which is so cool because it's so unique. And I'm like, dude, he's a freaking academic. You know what I mean? Like, no way, Leah, you started jujitsu. Let's go. Oh my God. Let's go. Oh my God, Leah. That is amazing. Oh my God. I'm so happy for you. Let's go. Um, so yeah, my professor, after the sexual assault allegations and stuff, everyone dipped, and I mean, obviously he dipped too. It's just taken like 6 months for him to get everything kind of going, and now that it has, it's gonna be cool, guys. I'm so excited. We have like, it's coming up. It's gonna be so cool. I'm so excited about it. So yeah, we'll have to see. Um, it's gonna start next week. I'm so pumped. I'm so pumped. The pictures look so good. It's just one giant huge mat. I mean, you're looking at it and you're thinking like, what's the cool part about that? But I mean, that's just like that's all you need. And I'm really excited. I'm gonna smoke a brisket for it. I'm really excited about it. I told my niece and she's gonna start jujitsu. Nice. She's thinking about karate, and I was kind of swayed. No, no, no. Do not do karate. Do jujitsu. Do jujitsu. Jujitsu will change your life. Karate will be kind of like something that you did. It is. It's not. Thank you, Justin. Um. So yeah, you definitely you want jujitsu. You want jujitsu because you can actually use jujitsu and to change your self-confidence. You could change what's up, Justin? Um, yeah, so it's big. It's big. So I'm so excited. Have jujitsu starting up again next week. Gonna have hopefully a job interview. I actually have a second interview already for that company that I interviewed with today. They're like moving fast on it since it's the temporary position and it's only a 6-month contract. They're moving really fast. And I know someone that works there that I used to work with at my old biotechnology company. So again, it's all coming up. It's coming together, so it's cool. I mean, hopefully my goal is I sign with this agency and then I can do auditions and stuff here, and do as many as I want, and then try to land the auditions, and then also take the job. That'd be really cool. So go back into the lab, and then I don't know what I would do for like the days that I need to like drive up to Hollywood or something. I think that sucks, but whatever. Yeah, it is. Yeah, Helen, I know it is. It's so funny. The idea that I would have to turn down acting gigs now because of science. It's like, I was asking Claude like how much do these acting gigs actually pay? And it's not much. I mean, we're talking like $1,000 to $2,000 a thing, and you're doing like one a week maybe. So it's super tough. It's like you're not necessarily landing like $1 million deals or something. You know what I mean? So it's actually kind of crappy in that aspect. So the Claude thinks it's going to take about a year to get going. So I don't have that time. I have to like pay my mortgage, you know what I mean? So I need to like get going. Oh, thanks, F1. Thank you. I hope you get the 6 months to start and all you desire. Thank you. Aw. Yeah, Lauren, I do. I have a really good feel buzz. I have today was an amazing day. Today was like all time to have like the acting thing and then the job interview and then the jujitsu thing. That's like, and that's my entire life. You know what I mean? That's like that's everything right now. Thank you, Lauren. You're very kind. Thank you. Um, yeah. So we'll have to see. We'll have to see. I also was thinking today about mohawking my hair and dyeing it pink. So that's also on the cards. So I don't know. We'll have to see. um uh yeah, she's been awesome. I mean, my wife is amazing. So she's in the final throes of graduating with her DNP. So that is the she's awesome. Like she's going to be graduating next year and yeah. So it's actually kind of cool. I'm going to be able to wear my silly PhD hat, you know, and her she said doctor of nurse practitioner. So a doctorate of nurse practitioner. You can have your master's or you can have your doctorate for being a nurse practitioner, and she's gonna have her doctorate. So we're gonna have two doctorates. Yeah. Which sucks because of California, basically the MDs sued California and said that DNPs can never be actually called doctors even though they have a doctorate. So she technically isn't doctor. She's a doctor in my mind, you know. So there you go. No, she doesn't want to do healthcare admin necessarily, but I mean she's you know doing, and they basically have you know autonomy on the field, you know. So that's what she's gonna have. Yeah, she that's yeah, Leia, it's gonna be Dr. Greg. So that's what she's but no, it's gonna be cool. I'm really proud of her. She's doing so well. We're on the throes of it. Yeah, that is her. It is Mr. Dr. G. Yeah, it is. She actually, we have Instagram photos of our. She's so funny. She got so okay. So this is we're getting into the weeds. This is so for me. I hated when we were getting married. All right, there's this thing where I'm, you know, I'm Mr. Greg Newkirk, right? That's who I am. But for her, how people addressed her would be Mrs. Greg Newkirk. So you would have Mr. and Mrs. Greg Newkirk, right? But there is no Mrs. Greg Newkirk. That's really, and it was like, that's so weird. I hated that. I hated when people called her Mrs. Greg Newkirk. Like she is her own person. You know what I mean? She is her own thing. Like why would it be okay to call like use her name? You know what I mean? It's it's Mr. Greg and Mrs. Blank Newkirk, right? Um so I always hated that. And so she's kind of like playing into where is it? Let's see. Let's see. I'm trying to find it. This is us. I don't know if I want to show this. Well, it's whatever. It's out there on the internet, guys. It's out there on the internet. But this is do. Sorry, one second. Yeah, this is us. We went to that rave the other. This is us hanging out. Dude, she's so beautiful. Like, so we went to the rave, and then we had this is me in my Mava gear. We went for 4th of July. This is we went I went full. Oh no. Yeah. Yeah, she's incredible. Yeah, so she's playing up the whole Mrs. Dr. G thing. Like in this issue, so she got us custom Padres. She got us both custom Padres jerseys, and then she's playing up the thing. So it's very funny. It's so funny. So yeah. But she knows that I don't really like it, so she's kind of like jabbing at me a little bit, you know what I mean? Where I'm like, "Ugh," like, but she loves it. It's very funny. It's really really important for, because like it's part of that like patriarchal society, right? Where, like it's kind of BS, right? Where like, why is it okay that why are you in reference to me? No, obviously, yeah, exactly, Michelle. She's she's too confident to care. You know what I mean? She's a bombshell. She understands it. But you know what I mean? It's like, and Helen, I get it. And she's teasing me. But it's like, it just frustrates me. Like, this is the stuff. This literally is the patriarchal little things that you find, and you're like, what is this? Like, this is so weird. You know what I mean? Um, so yeah. But anyway, so that's my beautiful wife. Yeah. Yeah, Leia. I mean, the first thing is to acknowledge it, right? You have to acknowledge that it exists, and that it's not okay. Yes, I am, Hazel. Absolutely. I am the lucky one. Trust me. She is a huge catch. So I'm very lucky, and um, so it's really fun. It's really it's nice. It's nice. It's nice. Like yeah. It's funny. Like talking. Um, did you have someone to influence you and your thoughts about how women are treated in society? Huh. Um. I mean, not really. I've never really thought about that. No, not really. Yeah. Yeah, not really. It's just like, I guess I've been paying attention to politics for so long, like, it's, as I've gotten older, it's been easier to see, like the stuff, there's just like things that don't feel right. You know what I mean? And like, I've always felt like my wife, she's like an equal part to me. Do you know what I mean? Like, we are both at 100%, and unpacking the thing that, like, the tit for tat mentality that I had going into it when the marriage counseling really helped me with this, actually, because like he was talking about, like, true love doesn't keep lists. True love doesn't, um, you know, like about how things are going. You know what I mean? Like, you did this, so I did this, and I hate when you do this and you did this and then you didn't listen to me and do this. And that's how I kind of like kept things in my brain where I was like, okay, there are things that you're doing and I'm keeping a mental list. So then then we're in a fight or something that's happened, I'm going to say, hey, look at this, see, you've been doing this entire time. You know what? Scorekeeping. Exactly. Exactly. And it really like helped me when things, and this is why therapy is so good when things are going well, because it allowed me to like unpack that in my brain and be like, hey, no, actually, I just need to love unconditionally, and I need to give 100% of myself without any preconception of I'm going to get anything back. That's what I need, you know? Thank you. Thank you. So that was a huge thing. Like that's what people being that's both people giving 100% of themselves. Like before I was giving 50%, and now it's like me giving 100% of myself to it. And and when that happened, then it's kind of like, well now it's like, before I would have been like, well, I get the Mr. and Mrs. thing, and you get this thing, you know what I mean, where it kind of balances out or whatever. And now I'm like, well, I'm like not like protective of my wife, but at the same time I'm like, why isn't this thing upholding her to 100%? You know what I mean? Like, why isn't she getting 100% of the credit here? And you get it with like kids too. Like when we're going out places, when I take all 4 kids, which happens all the time because we're constantly like out and about, I constantly get like, wow, good job, dad. You're doing a great job. Or like if someone wants to be kind of weird about it, they'll be like, whoa, dad's on kid duty today or whatever. And I'm like, no, I'm not babysitting. I'm their dad. I hate that actually. I'm like really mad when people say that, because I'm like, no, it's not babysitting when dad does it. And I hate it when my friends do that too. They're like, I'm on dad duty right now or whatever. And I'm like, aren't you a dad all the time? Like, what are you talking about? Aren't you always on dad duty? Like I don't stop being a dad. Like, what are you talking about? I don't have to. It's just very weird. I guess I understand, like I am the only person that's at home, so therefore um I'm in the sole proprietary, like, watchmanship of this. But um yeah, it's just, I don't know, man. I think but my wife doesn't get that ever. There's never any type of like, she gets it the other way. She actually gets it the other way. She gets, when she has all the kids out, she gets, you look like you got your hands full. And it's like, what? Like, that's kind of saying that things are kind of getting a little crazy for you, aren't it? And you're like, I chose to have this many kids. I like this level of chaos. Okay. I'm not, okay. We're not all like perfectly in a row or whatever, but hey, you know what? We're having fun with it. We're definitely doing just fine. You know what I mean? Like this whole idea of like, you got your hands full, me kind of is the presupposition is that like things are kind of going off the rails a little bit, you know? Jared, thanks for hanging out, bro. It's good a conversation to have. Speech is a real threat today in a way our forefathers never could have predicted, similar to the mistake of the Second Amendment. Oh, interesting. Yeah, you guys are having a good First Amendment debate on in YouTube chat. I haven't been following with it, but I'm happy you guys are chatting, man. So that's really what it is, I think. No, it's okay. It's cool, man. No, it's not. No, no, I love it. No, 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 please, please. No, you're good. You're good. Please. Genuinely. I think it's awesome. Thank you for talking about this. It's so true. Hell, I can't even be an electrical apprentice. Really, due to stereotypes? Oh, that's so weird. Dude, that's so frustrating. It's very weird. Um, yeah, I think that there's a lot of like, yeah, I don't know. I'll take the blame. Don't. No, you guys are fine. There's no blame. I'm not. There's no blame. Genuinely, guys. That's good. It helps me. I honestly makes me so happy to see people in YouTube chat and Twitch chat like hanging out. Like genuinely, man. Like I freaking love it. Like YouTube is like really helping me a lot. Like genuinely, I think. Dude, stop the stupidity. Another 5 gifted subs. Oh my gosh. Dude, thank you so much, bro. Let's see. Please, please get Michael and Jared. Please. Yeah, dude. The engagement does go a long way because people are like just are there, and then more people come in. Like it's crazy. Like, it really does help. Like having actual numbers there, people will actually bring it. Do both your parents have similar traits when it boils down to it? I like had a really close relationship with my mom all my life, like really strong. Um, and she was always really strong, really um working, you know. She was a superhero, you know. She was like literally, she would get called out when people were choking and had things like in their esophagus, and she was a GI nurse, and she literally had to be like called away, you know, from our, you know, Christmas dinners and stuff in order to go like save people. Like she was like literally a superhero. Um and yeah, I always had a really good relationship with my mom. My dad, it was tough. I growing up, I was really confrontational as a teenager, you know, always arguing, and and so my dad like took the brunt of that, and we kind of like, and he always, you know, takes the opposite side. Even god, even this week we were talking about the Plattner thing, and you know, and it was just like he always says things that are really incendiary, you know, and I'm just like, okay, let's go, stop that. Like, what do you mean, you know? And so it's kind of frustrating, but Um, I actually went to therapy at 16 years old, to try to help with my dad, um, for this, you know, so that I could, you know, better that relationship. He never went, which was kind of weird, but so, but that, yeah, that was like my first like the step in that, um, and I, yeah, I've always been really close with my mom. So her passing was really tough. We're coming up to a year. And I think it's September. I don't even know the date. It's kind of weird. I don't even know the date. I don't even want to know the date. Yeah, I don't think I want to know the date. I think I'm okay not knowing. It's been wild. In a way, in a lot of ways, I think about my mom way more now that she's dead. It's really interesting. Like I talk, I hold my chest and say I love you, mom, like every day, just to like, I had a moment where I was so sad because I was like, I'm never gonna tell my mom I love her anymore. So I was like, I can just do that though. I can just do that, you know? So I just like hold my chest and say I love you, mom. Um, so it's been nice in that way. Yeah, Michelle, I do. Yeah, I do. You know, like I do. I smile. You know, like it's still fresh. You know, like she's such a big part of my life, and I love her so much. Like we moved up to North County, San Diego, specifically to be close to her, so that she could watch the kids. You know, like we bought this house in this area specifically like for her to be, and we have like a big area in the back that we wanted to like build a granny flat for her, where so like presumably like when my dad passed first, then she could like move in with us. So we yeah. Do you get signs from her? Wow, Bobby, that's a really wild thing you said, because um so we planted a butterfly garden. Oh, thank you, Dr. Joe. Oh, thank you, brother. I appreciate you saying that, man. Um, thank you. That's very heartfelt. Thank you, man. Oh my God, Heather. Yes, yes. So, okay. So this is like an ask me anything for, okay, we're really going into tonight. Okay. We, we, I lost my job. I was laid off in October. I was laid off in October, and um and it's been tough. I was able to make some money in the stock market, but it's not enough in order to float us. And I know I just wanted to get it off of screen for TikTok purposes. and and then she died like the month before that. So within a month, I got laid off and my mom died. So yeah, I am. I'm born and raised California. Oh my gosh. Can you guys hear that? Oh my God. So okay, so when she died though, my parents don't have like any money. Like they're not like rich or anything. They've been like most homes in Southern California are $1 million, okay? But people don't have $1 million in them. If you aren't aware, like the money that you put in as and you pay as a mortgage, you can take out a second mortgage on that money. It's called a home equity line of credit. And basically everyone is living off of, at least my parents did, like lived off of HELOCing their stuff. So they don't have any like equity in their home, even though it's gone from like 100,000 to $1 million. And and that's how most people live, like in California. You know, it's just like that's just how it is. Um so there wasn't any inheritance or anything when my mom passed. And but the life insurance money, this is Bobby, this is for you. This is your story, Bobby. Sorry. Sorry. I hope you're still in chat. Um Basically we took the life insurance money that my mom gave us, with that gave my dad, and we didn't have money to do our landscaping. We bought this house new, because it was under $800,000 in San Diego County, ladies and gentlemen. I mean, it's like a crazy deal. I mean, seriously, like that doesn't exist like in anywhere in San Diego County. Like it's just wild. And I know exactly, Bobby. And um, but it was a blank lot, a dirt lot, and we couldn't we had to build something on it within a year, and we were 6 months after that, and we were getting notices from the HOA that we needed to build something. And I was like, we don't have the money. And it's we when we got the lot, when we got the house, when we picked the house, it was our dream setup, our unit on the biggest lot in the whole place, in the whole development. And we were like, oh my gosh, this is amazing. Like, we get to have, you know, the biggest lot. This is so cool. So we're gonna have a giant backyard. Yeah, that's cool and all, and it is cool, but also it's the most expensive thing that you could possibly landscape. Like, we had 10 different landscapers out here giving us quotes, and every single one of them was like licking their lips. Literally, this one guy was like, ah, this is $100,000 job right here, and like excited about it. And I'm like, oh my God, get out of here, dude. We're not spending $100,000 on landscaping, bro. Get out of here. So we finally like had someone come out that could do that for like half of the cost of that. And I was like, okay, we still can't afford that. Like, I don't have it. I'm not working. But we have our savings that we had that we could just like spend on that, but then we don't have any savings, and I'm unemployed. That doesn't work. So my dad was like, okay, well, we can pay with your mom's life insurance money. We can get you out of this hole that you need to spend for the HOA in order to like do that. We'll pay for your landscaping with it. And I'm like, okay, well, I mean, that works. And basically, obviously I'm really into insects. I'm all super into wildlife. I'm super into indigenous plants and insects and all that kind of stuff. And my mom loved butterfly gardens. So she planted milkweed like everywhere, and the other plant that it needs in order to like, live is she planted that in their backyard at their home in San Clemente. So you're so we were like, oh, we'll do a massive it's a huge slope. We'll do a massive butterfly garden. And so we did that. We planned it all out. We planned out all the plants. We planned out everything. And they finally planted it. And the first day that the entire family, oh, thank you, Efon. Thank you so much. So the first day, right after they had planted my mom's butterfly garden, a butterfly flew through, and we saw it fly through, and we were like, oh my God, that is so wild. You know what I mean? Like, I don't believe in God. I mean, I'm an atheist, but like, those are the moments where I'm like, damn, this is an amazing coincidence. I'm like living through this moment right then. You know what I mean? I'm like, that is so wild. That feels like, that my mom coming home or something. You know what I mean? And it was so cool because everyone's out there. We're all playing, and like, because I mean, to go from like a dirt lot, like a literal dirt lot, to like an actual, there's cement and we have like grass planted now and stuff. So it was like, we actually like being outside more, which is more fun. And there's the plants now. I'm really excited to see how it all comes in. And yeah, just to see a butterfly there was just wild. Exactly, Leia. Well, that's the thing. It's like, um, I don't know. I think there's. I think about my mom now way more than when before she passed, and I do think like it really is that Obi-Wan Kenobi thing where it's like, if you kill me, you'll only make me stronger, and it's like absolutely, um, it's absolutely that way with my mom. You know what I mean? It's absolutely that way. Like, she's only become stronger inside of me, like since she passed. So my dad had passed away 100 years old plus 4 months. Wow, I never cried a tear. I was happy for him. He told me he was hurting. Well, dang. Wow, interesting. Oh, thank you. Thank you, Natorabot. Thank you. Yeah, this is a long story, but Thank you, Bobby. Thank you for asking that. That was an amazing question. Yeah, signs from those who pass. You just feel it when you see it. It's amazing. Yeah, Bobby. I can see that. I can see that. Did you enjoy the Kent Hovind debate you did? He gave me a headache the whole time. I loved it. I loved it, Anthony. I am so sick of these people existing in the world with no pushback. It is so frustrating to me how we've completely coddled these people and how they're able to just go on there like unchallenged, and people will like it, it's so aggravating, and I think that like for normal people, for people that are misinformed, that are the victims of Kent Hovind's information, I'm genuinely sympathetic for, like, and I want to hold out a hand to help them up rather than push them down, but we have got to fight back. We have got to start fighting back against the agents of disinformation themselves, the people that actually create this nonsense and push this nonsense. Like we have got to push. Yeah, there's so many. In the naturopath stuff, it's like it's such the easy grift now. Everyone does it to make money. So it's just, oh, GN. Oh, thank you. Thank you. Yeah, opening up a second device on YouTube, it was amazing, guys. Thank you. I think it looks better. I don't know why, but there's more reds on the YouTube stream. I'm like looking at it on my monitor right now, and it's the same like it's just a virtual camera on the other one, but it seems to be fun. Dogs produce dogs, cats produce cats. Yeah, exactly. I get offered to sell stuff all the time. I don't get why people don't have integrity anymore. I've had multiple peptide companies come up and ask me to be like their spokesperson. So, but see, Dr. Joe, I've thought about so my physician friend who does science-based fitness content, and she pushes back against the conspiracies in that world too. And she gets brand deals for clothes. And I think that that's okay. I would take a brand deal for clothes, I think. Like anything medical or anything like that, I would not do. But if for clothes or anything like that, I think that that's ethically okay. And I think that it's an interesting thing that she does because she wears like their stuff when she works out and all that kind of stuff. And it supplements her income, and she spends more time making content because she makes money doing it. And that's how most people make their money that do content. My brother, who is a doctor in Menifees, even says anyone. My brother, who is a doctor in Menifee, even says anyone who decides the holistic shit eventually goes to the hospital and they use the actual stuff. Exactly, Anthony, exactly. There is no holistic hospital. You know what I mean? There is none. They don't have holistic hospitals, guys, because at the end of the day, if you break your arm, you're not going to a shaman. You're not going to your local apothecary. Like, come on, guys. Like, we know this. We know this. That's fine. I also think it's okay if it's a genuinely good for humanity. That's fine. Yeah. I mean, it sucks, man, but I do feel like, you know, like, yeah, like making money doing, content creation makes you want to do it more. That's just like, I don't know what it is. And I'm sure you get it, Dr. Joe. I'm sure you get the Pharma shill and all that kind of stuff. Which is, by the way, I just submitted multiple applications for Eli Lilly this week. So please, Eli Lilly, if I could, and like Merck is hiring right now. So like the idea that I could be hired at a pharmaceutical company, but what I'd be doing would be the research and development as opposed to like paid Marketing. Yeah. When we say dogs produce dogs, our language implies there is an unchangeable dogness that gets passed down perfectly. Yes, exactly. In philosophy, this is called essentialism. Yeah, it would be like DOG produces DOGG. You know what I mean? Or DHOG. You know, those type of things, like those type of mutations, where you could technically still do dog with that word, you know, but like dog, and you would still refer to it. You just write it a little differently or say it a little differently. Like we do have evolution. That's what dialectics are, right? Where it's like that's what when people you know, different accents, languages evolved, you know? So even his own example, and this is exactly what you're talking about, like languages do evolve. Yeah, sure, Dr. Joe. I mean, I could do remote work from Boston, but I can't move there, unfortunately. So that is one of the stipulations that's been holding like me back a little bit, but I live in San Diego, so yeah, dude, I would love to. Um, You'd probably make a good pharmaceutical rep. You know what's funny? You know what's funny is that one of the modeling things that I did, one of the shots that I did was me in the lab coat precisely because I could do commercial acting to be their spokesperson, and they put those gigs pay super well. It's like $5,000 a month. It's really good stuff. So I am applying to like Pfizer and Merck and Moderna and like all these companies like on the research and development side and the front of house. That'd be so funny. Oh, Dr. Joe. Oh, perfect. That's for just a summit. They're from everywhere. Oh, that's cool, man. Yeah. That'd be amazing. Oh, dude, Anthony, that was so yeah. Carbon dating is so wild. Like we were going through an age of Earth debate yesterday. I'm gonna put out the video tomorrow, but Dr. Blitz was on the Raging Tomato panel, and they were asking him about that. It's like he was seriously defending 6,000-year-old Earth, and it's like, bro, we can count layers of ice sheets. You know, like we're talking like literally counting 1 to 800,000. Like it's not some radiometric dating isotope fall off neutrons over time thing. It's literally counting from 1 to 800,000. It's like the idea that 6,000-year-old Earth is genuinely up there. Yeah, he's dude, the the Ken Hovind debate was wild. I'm so desperate to get another debate like that. I'm trying to get it on. Yeah. So I'll try to see what's going on. Yeah, there's some he's definitely accumulated some deleterious mutations, Dr. Joe. um, was he able to tell you when the last time is when you hit summer or sorry, dude, he's wild. It was wild. What happened to the interview today? Did you miss? They both went really well. I had an interview at a modeling and acting agency that went really well, and then I also had an interview at a sequencing company that went really well. So, yeah. Oh, hot Earth summer. Oh, okay, gotcha. Yeah, exactly. Gotcha. That's good. That's good, Heather. You could do it with Kirk Cameron. Oh, that's a good idea. That's a really good idea. His original Kirk Cameron ones. Yeah, the um reacting to their stuff is basically as close as I can get to actually like debating them. And react content does well on YouTube, you know what I mean? So um Oh my god, I used to watch this stuff, guys. This was like early YouTube. This is like let's see. This is like I used to um like early YouTube, man. I was doing these Cameron debates. Oh yeah.
Now, you and I have something inside of our bodies called DNA. You have 10 trillion cells, and in those cells is DNA. DNA are micro.
Okay, I'm not actually gonna react to this, but I'm just that this is a great idea. God. You don't get to tell me what DNA is. You don't get to tell me. Don't tell me what DNA is. Yeah, exactly, Anthony. Like it's these like the suppositions where you're like, we should do this just back to them. You know what I mean? Like, I think that that's what we have to do. Like, we have to just, you know, the 6,000-year-old, like, they do such a good job of projecting their insecurities that you really can't, you don't have much to latch on to. You know what I mean? It's they do it's so well because then as soon as they project their insecurities, then they can say, yeah, well, both sides, both sides. It's actually it's how they handle politics as well, right? Like, they talk about like, oh, religion, science is a religion, and you just have to have faith. And it's like, I thought religion was a good thing and faith was a virtue. Like, I'm so confused. Like, how is that a bad thing to have? And then, but in the same way, and then they can say, oh, both sides are required to have faith, and in the same way, they'll they'll do it in politics, right? Well, they'll say like, oh, well, everyone's corrupt. Everyone now that Trump does all this corrupt stuff, oh, well, everyone's corrupt. It's like, well, but why? Oh, because of Biden. Biden's the Biden crime family. Don't you understand? You're like, but they're both sides. It's the both sides. It's like a lack of nuance. It's like a lack of it's a lack of depth. You know what I mean? Like, what is actually happening? The people just aren't engaging anything deeper than surface level understanding, right? So frustrating. So frustrating. Sorry. Yeah. Yeah, Bobby. I think as they like leave MAGA, you'll definitely see them kind of like that's going to be their go-to. Their go-to is going to be like, well, nobody actually knew. That's too much. Yeah. I like having the marquee in there. You have to admit that it happens on both sides, though. There's no they with this regard. Okay, Sacred. We're gonna. How are you multi-guested? How late do you sleep? Until like 6:30, like when the market opens, and then I check and see how stuff is going, and then, um, yeah, and then the kids usually wake me up. I exist on naps. That's how I exist in the world. How long has the main man got left in his term? Oh man, um, 2 years, I think. 2 years and change. Um, Sacred is profane. Can't invite you. tried. Yeah, I usually go to bed at like at 2, wake up at like around like 6:30 to 7. I don't understand like why don't you just come up though and like have a discussion? You always sit in chat and always like always say things like this. Well, why can't we just chat then? Yeah, I think like the fact exactly it this is what I don't get it. I don't get how they're able how MAGA is able to completely destroy science politically and have a complete devastation of universities, research institutes, science as a whole. And then when we fight back, it's like we can't do that. We can't do that. It's a it's just really frustrating. It's really frustrating to see no accountability happen to the people that are actually perpetrating severe harm to the Constitution, to people, and them scapegoat and throw people under the bus that have like done really nothing in comparison. When in reality, they're just cowards and they're not capable of having any type of self-reflection to just be better and not do toxic things in society. But because they keep winning, there's no reason for them not to be toxic, right? And the fact that like people, there's a difference between like genuinely, I think that there's like a big difference between someone that is just incapable of doing their job, really bad at doing their job, which is like George W. Bush, right? I think that he's just really not capable of like doing a really good job as the president, right? Um, I think that I don't think that he's malicious like in what he was doing though. I don't think that he was like actually like a toxic person in the like in the world. He was malignant, right? He had a lot of bad things that happened, but I don't think that he was like out there to um destroy everything else, you know. Cheney was though. um I think that that's fair, but I guess my point is that there's like a big difference between George W. Bush that was still trying to build a United States versus Trump wants to destroy the United States. Like that's the difference. Like there is no he like Trump is trying to create a world that only exists in his brain that we never were, right? This like George W. Bush at least and Republicans before him were interested in the Constitution, the United States as a whole, voters that didn't vote for them. They still like wanted to be presidential, you know, and then Trump is out only for himself. Everyone knows this. Everyone can see this. Trump is only out for himself. So therefore, the corruption that might happen, like during the George W. Bush administration, like he's at least in good fit in his mind, going out forward in the direction to improve the United States, and he's stumbling along the way. But But what Trump is doing is that he is creating a completely different nation and only out for himself. So therefore, all his corruption and all his toxicity is for everyone else in the world that doesn't agree with him. So he isn't the president for anyone other than Republican voters. He denounces everyone else that isn't with him, right? So he's fundamentally toxic to everyone else that doesn't support him, which is why everyone has to bend the knee, from politicians to business leaders to international presidents, prime ministers, all these people that have to pay servitude to him in order to get something. So what that means is when the toxicity and the corruption exists, it's only to serve Donald Trump, right? It only exists to perpetrate Donald Trump personally. George Bush was not personally benefiting from his corruption, right? Or his the bad things that he was doing. Do you know what I mean? Like, he was corrupt in giving his friends, like, Blackwater, these no bid contracts and that kind of stuff. But he wasn't making billions of dollars while doing that. He wasn't personally enriching himself. He had improprietary, had decisions that transparently were decided by money, right? That he might have gotten in gifts or all that kind of stuff. Even in the worst case scenario, let's say like he's literally getting, you know, he's getting things from it. I don't think that Trump's corruption, that where he's making money off of it. He's making money off of the presidency of the United States personally, and he's getting the gifts, and he's getting the access. There's like a level of corruption that has not existed before. So to say that, oh, they're just both corrupt, like that, you're not understanding what's happening. You're just not understanding exactly. And they crucify Hunter Biden. By the way, guys, I am entering the Hunter Biden stage in my life. I'm gonna start wearing jean shirts. I'm not joking. It's coming in. I'm really excited about this. I love his jean shirt look, so I'm going for it. I'm going for jean long term. Like, it's gonna be good. It's gonna be so good. I want to see if it actually came. It's gonna be so good. I'm so excited. Jean shirts. All right. Oh, okay. It's sometime today. It's gonna be good. Trump is a pressure test. He's temporary. What comes after Trump matters more. Yeah, I don't think that you really understand what happens with Trump. I don't think that you really get it, though. Like, I don't think that Trump is temporary. Like, I don't. Trump is Trump. Trump has shown a an off ramp, that he's shown an exploit in the code that we can't come back from. Like, there is no bringing the, Pandora's, box has been opened. There is no going back. And that's what pressure does do. Okay. The thing is that the Republicans, in order to actually change, like, what do you think is going to make the Republican Party want to change? And the pressure test means that at some point the test is concluded. So what makes you think that MAGA is going to stop being corrupt when being corrupt has gotten them so much. There's so much. How do you fix? We have to fix the Supreme Court, or there's no. Oh, I mean, Malanon. That's, bro. If I mean, we've literally. This is exactly the problem. This is exactly the problem. Malanon, I don't think that you're. This is. It's a valid question, but this is the problem with Democrats, though. This is the problem with us, guys. We're like, should we do the legal thing that's existed and we've done before many times in our past? versus like Trump is like, I don't like this constitutional amendment. It doesn't exist anymore. I don't know. Birthright and citizenship doesn't exist. I don't care what you think. And we're all like, can we actually do the thing that is legal and we've done historically before? And you know what I mean? Like, if anyone is not on board with changing the composition of the Supreme Court, I have no, you're lost. You know what I mean? Like, that's what I'm trying to say. Like it's as easy as passing legislation. It's you literally, it's a 50% plus one. Like, you don't, like, that's such a slam dunk thing. Like, that's so easy. Like, if you're not if you're not prepared to do a 50% plus one legal thing that we've done before, that's totally legal. Like, we have to go, guys, like, this is what I'm saying. We have to go through a complete constitutional reconstruction for the second time in our country. Like, we are basically at a cold civil war right now. And after deconstruction, right, we have to reconstruct all these institutions that we have, that we had, that we don't have anymore. Like, we have to deconstruct MAGA from our government. We need to ban MAGA. Like, MAGA politicians should be all impeached. Like, none of them are capable. None of the judgeships should be allowed to stand. They are all like, they've all been inserted, and they packed the courts with ideologues that have no presence of mind towards the Constitution at all. They're completely unqualified. They don't have any law background, and they literally go in and they have complete fealty to Trump, and that's it. So they have to be removed with impeachment. Like, they have to. I agree, Michelle. I mean, they're probably not. But I mean, we have to put pressure on them. I mean, I'm not going to vote for anyone that doesn't have like an actual modern view of American society. Like, I'm just not. Like, I don't want. I'm so sick of that. Like, that's just done, you know? What's up, dude?
Hey, Dr. Greg.
Hey.
How are you, man?
Good. A lot of background, but what's up?
My background?
Okay, you're good now. What's up?
Okay, that's better. How's your night going?
Good.
I just stepped in here. I don't know what you're talking about, but I'm just interested.
Okay. Gotcha.
I've been following you and listening to you for a while.
Oh, okay, cool, man. Thank you. Yeah, we were talking about oh, thank you, Last Dark Unicorn. Thank you, appreciate that. I think basically, I think that the Constitution of the United States has basically irreparably been shown to have a fatal flaw in it that we really can only fix by a constitutional convention or something. There has to be a way to change and fix these holes. I don't know how else to do it. So that's
I agree, but I feel like at this point we're so we're so deep and down that I just feel like there has to be like a constitutional reset. I don't even know where to begin.
Yeah, I think, you know, a lot, and the problem is a lot of the, you know, Bannon types and stuff, like Capital is so strong, you know, they have basically every reason to go through a constitutional convention too, because then like Capital will have so much power in that scenario, and they can, I mean, if people don't know, like during a constitutional convention, you could rewrite the entire Constitution of the United States. Like we basically have a dry erase board, complete rewipe that's a reset of our Constitution within the Constitution. So that's also why people that are like violent revolutionaries are complete losers, because we have in the United States uniquely the ability to do a political revolution reset, and like we have that capability. So but that's also dangerous, because in those scenarios, the safeguards that we have against capital and stuff would not be necessarily be there. So it could be it should just be really dangerous.
I agree. And the thing is, like, our debt clock, it just keeps increasing. And when like there's no value behind any currency right now, and even though they say the US is the benchmark and there's so many reserves out there, eventually people are just going to call bullshit on that, right? Like when there's no backing on it anymore, right? We just continue to print currency and just continue to raise inflation.
Dude, so I wrote this game, simecon.app, and the idea is that you can basically see if you can fix the mess that we have, which is the $36 trillion in debt. And it's honestly, dude, it's shockingly easy. Like it's wild. Like you just have to go to like the Eisenhower era plan, and already we go from a $2 trillion deficit down to $1 trillion deficit. So deficit is how much you're in the hole every month, right? So that's how much you're in the red.
Yeah.
How much money that you're burning as opposed to taking in. Debt is the total amount that we have. So so just doing that alone, which increases the top marginal tax rate of over, if you're making over $560,000 a year, you're going to be taxed at 91%. And then income rates above 231 would be at 50%. And there's other taxes too that you can do: capital gains, value added taxes, carbon taxes, taxing wealth, that kind of thing. But it's remarkably simple, dude. Like it really is a choice that we have to do it. It's pretty frustrating, actually.
The problem is that nobody implements it though, because the thing is the rich keep getting richer and middle class keeps like suffering, right?
Mhm.
There is no such thing now as the middle class.
Sydney, come here.
Because the thing is, and the problem is the way things are going right now, the way I see it, it's going to take forever to get out of that deficit because no one's actually putting the correct things into order. Like, and if it was so easy, why hasn't it been done?
It's just political decision making, man. People don't want to, they'd rather do budget reconciliation with 50% plus one, and they don't have to. Like they can raid the piggy bank for, you know, the infrastructure developments that we had for Biden, and then use that to offset the, you know, the Trump tax cuts, and then there you go. So, yeah, you can add a value added like that, just that right there. Like I've already balanced the budget. You just have like increase the taxes, and then just have like a value added tax, which is, or you could have it,
Did you just come up with this, or you've been thinking about this for some time? Like, this is impressive.
Oh, this is just a game that I made. Yeah, this is simecon.app.
Right.
So it's like, let's say you don't want to do that. Like, you don't have, like, I put tariffs in here just to see, like, look at how little the tariff like actually impacts things. Like, it's
I see that. Yeah.
it's not that much. You have to really go up to really high rates in order to have it. And that's not a good idea. Value at the land value tax. Is that it? Yeah. So basically, empty lots and stuff like that, you basically can have a tax on those. So it kind of like pushes people to develop on those empty lots, which is cool. You add a financial transaction tax, a billionaire minimum tax, stock buybacks, closed carried interest loopholes, and let's see, where is the total? Like, you're really, you can do a lot of these things and get it down really quickly, man. Like, it really is.
So hypothetically, in like all realization, how quick do you think that they can bring that down if they actually care to? Like,
Man,
and my question to you,
Mhm.
my second question to you, why haven't they implemented it? Right? Because right now, as a world leader and as a world currency holder, because everybody dictates their currency based on the USD, and there's so many reserves that are, everyone could pull the reserves out of, lack of confidence, and then our currency would just devalue. So when does someone make the decision to take the upper hand and make the correction before people have disbelief in the U.S. and devalue our currency on their own? Because we're all powered by the world, right? And that's and those decisions.
So right here, I just used Eisenhower's tax plan, okay, and then we added federal land value tax, right? And then I did a bunch of taxing on wealth on Wall Street. So you taxed wealth over 50 million, and like anything over 50 million, 5% tax, financial transaction tax, that kind of stuff. And we're already that means that we're debt free by 2043 as a country. We're actually a surplus, a $6 trillion surplus. So you can actually, like, in this, if we actually taxed Wall Street and had Eisenhower, right? Eisenhower tax plans, okay? Now we actually have money to spend on other things, right? So like the $6 trillion surplus is kind of a lot. So now you could add things like permanent child tax credit, free public college, universal pre-K. And look how it's like not even changing, dude. Look at how cheap these things are. Universal free school, baby bonds, all that stuff. Like, and then you have paid family leave, universal child care. Like, still, dude, we're debt free by 2050 with all those things that I just said. All of those things, all those programs that would impact hundreds of millions of people. Like, we're still
We should
debt
have
free.
started like yesterday.
We're
Wow.
still debt free by 2050. Like, it's just a choice. Like, that's what's crazy. Like, all these, like, these are just choices that we make in order to have debt as a country. Like, the politicians, like,
But right now, people aren't making the right choices.
the
How
politicians,
long
exactly. Yeah.
Yeah, exactly. But the thing is, that just shows weakness,
Mhm.
because like that shows vulnerability to other countries, and when we like, kind of like hold the upper hand with the currency, our reserves, everything. Like everything. I feel like everything is kind of dictated by the U.S. decision. But maybe I hope that continues to, revolve. But who knows for how long?
Yeah.
At this rate, who knows?
I get to fix the economy. I mean, I wanted to make a game out of it. I wanted to see kind of like what actually the numbers are. And it's like, cause I wanted to see people keep saying like, this is such a big number. And I wanted to see what it actually was. And it's like, it's shockingly easy. It's honestly like, cause I used to play Sim City, that's why I called it Sim Econ, Sim City, Sim Econ. And then I also made a San Diego edition too, because like I live in San Diego and everyone's talking about how it's like such a bad thing. Look at our police department. Look at this, how insane this is. Our number one expenditure as a city,
Wow.
704
It's like,
million for a
yeah.
police department. It's wildly
So
expensive.
now now I can understand your numbers very well. And I know this is like a sensitive subject, but do you invest a bit as well outside of
Yeah.
everything you do?
Mm-hmm.
Yeah.
Yeah, absolutely.
What
Yeah.
are you into? Stocks? Are you into crypto? What are you into?
Stocks for sure. I mean, crypto's been dead for a little bit, but DRAM is probably like the best stock right now, I think.
DRAM?
Yeah, DRAM is memory ETF. So it's basically it has all of the AI enabling memory companies in
Yes.
it, and it's so good, dude. It's a great stock. It's a great ETF. It's not technically a stock, but yeah, it's been out not for long, but it has like Micron, SanDisk, Western Digital. There's a holdings thing here.
So I've been following you for some time, but what do you do day in, day out? Are you a teacher? Do you teach?
I got laid off
Or
in October as a scientist, and I've been trying to apply and yeah, get back into the lab or yeah, that's basically it.
so right now you're self-employed, you're just like doing some like a little bit of consulting here and there, or
Yeah, yeah, I have a consulting business. I have I trade and um yeah, it's my main stuff.
right on. It seems like you have it. You know what? Everything happens in life for a reason, right? Maybe that was your destiny.
I hope so, man. That'd be nice. That'd be nice.
Because maybe you know what? I don't think that you're the kind of like I don't know. I don't know you very well, but what I know of you, I don't think that you would be a very good employee. Which I can admit I would be a shitty one because I've been self-employed all my entire life.
Mm.
And there's like people like our characteristics do very well on our own. Not
Yeah, I wouldn't mind being self-employed. It's just I need to get I just need the solid I need to pay my mortgage first, and that's like my number one thing. So it's just it's hard to consistently get the self-employed bank check, Like every
it's
day
diff-
every day is a green day, you know what I mean? For
it's
when you're making
difficult because there's a lot of insecurity with it, but once you get beyond that, like it's tough.
Mhm.
There's a lot of stress that comes with it, as you know. I don't need to tell you you're an intelligent man.
Mhm.
But like once you get beyond that, like the benefit is worth the consequence, right? So like as you know, I don't need to speak to you. Like you're an intelligent man. I can tell. But like you just have to I feel like you need to like create your own destiny. I don't know you well. I know you well enough. I've followed you and listened and take notice, and I think that's your path, as far as I could tell.
Thanks, man. Yeah, well, we'll see. I'm kind of we're pushing on all doors right now, see where it is, but yeah, the number one holdings SK Hynix, which is the South Korean memory, Samsung, Samsung. Nope, that's all right. All right, guys, I'm gonna take off. Oh man, dude, I redid my entire OBS thing and it's fixed. It's working so well right now. I'm so excited. I love it. I love it so much. Thanks for hanging out, guys. Oh. Oh. Oh, it's fine. I gotta go anyway, Rocky. It's all good, dude. Yeah. Thank you guys. Thank you for hanging out. I appreciate you. Thank you for hanging out in YouTube and the gifts. Thank you, Efon, for the super chat. Thank you, Stop the Stupidity, for 10 gifted subs. Helen for the super chat. Thank you so much. Thank you, Michelle, Ghostbusters, Helen, Heather, Cat Fiddle. Bobby was gifting too. Thank you so much. I appreciate you. Oh no, it's cool. It's cool, Rocky. I was gonna get off. Anyway. It's all good, brother. Thanks for coming up, man. Appreciate you. And yeah, I will see you guys mañana. Tomorrow. All right. Have a good one. Bye.